Order, please. The subcommittee on supply will come to order. It is now 3:20. At 3:20 p.m., the subcommittee is meeting to consider the estimates of the Department of Addictions and Mental Health as outlined in Resolution E29. I'll read E29. Resolved that a sum not exceeding $363,793,000 be granted to the Lieutenant Governor to defray the expenses in respect of the Office of Addictions and Mental Health pursuant to this estimate. I will now invite the Minister of Addictions and Mental Health to make opening comments of up to an hour, and if they wish, to introduce their staff to the committee. Minister?
Thank you, Mr. Chair, and good afternoon, everyone. It feels like it hasn't been that long since we did this, but I guess it was. So today I'm pleased to be joined by members of my senior team. To my right is the Deputy Minister, Kathleen Trott. To my left is Barry Burke. We also have Francine Vesna here today, Executive Director, and Eric Nolan, my Senior Advisor. So good afternoon. I'm very thankful to each of you for being here today. I'm very thankful to my staff and the department and to our health system partners across the province for their support and important work for Nova Scotians throughout the province each and every day. It's fair to say that everyone throughout Nova Scotia has a connection to mental health and addictions, whether they themselves or their families work in the field or access care and support services. Knowing the deep connection Nova Scotians have to this office and the critical supports it provides, I'm proud to be here to talk about the work we're doing by a great team who show up in every community throughout this province, from Cape Breton to Yarmouth and everywhere in between. Our office works closely with the Nova Scotia Health Authority, the IWK Health Centre, universities, and many community partners. We work with them to make sure Nova Scotians have access to vital mental health and addictions education, prevention, treatment, and recovery programs. Our team and partners being tremendous value as this government builds a world-class healthcare system right here at home in Nova Scotia. And with every building block we place and every investment we make, we're delivering. Just look at the accomplishments we've made since taking office. A new medical school at Cape Breton University and the first medical graduate assessment clinic in the world that will train, certify, and bring more new doctors every year. An increase in the number of doctors and nurses, investments in new buildings and equipment, supporting a modern healthcare system where healthcare professionals want to work. More primary care clinics, new collaborative care clinics, and improvements at existing clinics. Better access to virtual care. New mental health clinics in Halifax, Sydney, and Kentville. New recovery support centers in Dartmouth, New Glasgow, and Lunenburg, just to name a few. Clearly, this is a government that has invested in and accomplished big things. And both this government and this office will continue to accomplish big things, historic things. We have a bold plan to build a thriving, prosperous future for our province to create opportunities, strengthen our economy, and make life better for all Nova Scotians. When it comes to addictions and mental health care, we are investing and delivering unlike any government before. When I arrived in this office in 2021, what I saw very clearly was that the money being spent on addictions and mental health was far below the need. Nova Scotians were being shortchanged when it came to meaningful investments in mental health and addictions care. Since taking office, this government has invested more than $136 million than the former government did, almost a 40% increase, with a total budget now of more than $363 million, the biggest investment in mental health and addictions care ever in the history of our province. This investment reflects our historic commitment to Nova Scotians to provide universal mental health and addictions care. Nothing like that had ever been done before anywhere else in the country. We promise that no matter where you live in this province, no matter who you are, and no matter what your financial situation is, you would be able to access mental health and addictions care. And we're seeing real progress with more people than ever accessing a range of services from a range of providers scaled to meet their specific needs. Our work has been and continues to be focused on three key areas. First, our public healthcare system, where we're expanding the programs and services we have in place and adding new ones. Second, we're creating partnerships to tap into the skills and expertise of our universities community organizations, and the private sector. And finally, integration, making sure all of that comes together so when someone in our community needs mental health and addictions care, they just make one call, go through one door, and they can be connected to the care that they need. Whether it's from a clinician in a hospital or a therapist in an office or a local organization in their community, or a phone call with the peer support worker who has had a similar experience to themselves. This is what a universal system of care looks like. All of these services have a part to play. It's many different pieces delivered by many different people that help many different people in many different ways. That's what makes up one whole system of care. At the heart of the universal mental health care is the public health care system. The services provided by Nova Scotia Health and the IWK at our hospitals, our outpatient clinics, and throughout mobile clinics, and much more. Of the $136 million in new funding since our first budget in 2022, we've invested over 90% in the public health care system. These investments mean we were able to open 4 new mental health acute day hospitals in Halifax, Sydney, Kentville, and most recently, just 3 months ago, in Truro. Day hospitals like these help fill a gap between an inpatient stay and an outpatient treatment. They are for people with complex mental health needs who need more intensive support than what you get through an outpatient clinic, but also don't need to be 24/7 in an inpatient unit. This is what I mean when I say we're working on a universal system, with lots of different pieces to fit the needs of lots of different people. For some, a day hospital is the right fit, and it's an option that didn't exist in the province before. Now patients at a day hospital can get care from a multidisciplinary team. One that might include psychiatrists, nurses, social workers, occupational therapists, recreational therapists, and pharmacists. They provide care for Nova Scotians 7 days a week. Patients can get the treatment and support they need during the day with the benefit of going home at night. And this is happening in every single health zone across the province. Again, making investments in our public health care system is how we've connected to make services more supports available to everyone. Investments like our 12 new recovery support centers. Recovery support centers offer a low-barrier way to access care and support for Nova Scotians who want help with problematic substance use or problem gambling. And low barrier is important here because it's something we've seen a growing need for in communities across the province. At our recovery support centers, people are supported by a multidisciplinary team that includes nurses, nurse practitioners, social workers, and navigators, where they can access treatment one-on-one, take part in group programs, and get connected through other services like inpatient withdrawal or opioid use disorder treatment programs, or also community supports. We've opened 10 of these centers so far in Sydney, North Sydney, Strait Richmond, Glasgow, Truro, Middleton, Lunenburg, Yarmouth, Halifax, and Dartmouth. They are all providing care in those communities and have had more than 8,000 visits. This means people now have their easier access to in-person care in the communities where they live. And that access is only going to increase with 2 more planned to open this year, one in Amherst and the other in Spring Hill. Both day hospitals and recovery support centers are giving Nova Scotians options, connecting people with health care in a new way, a way that didn't exist before. Options like these mean people can get the care that fits their situation, which can mean less pressure on some of the other health systems, like emergency departments. That's what universal care looks like, options to fit people's needs. That's what we're doing with our integrated youth services as well, creating more options for people, including young people. Over the next 2 years, we'll be opening 8 integrated youth service sites in locations across the province, and the work is well underway for every site. Supported by the IWK, each site includes a local network of 4 or more agencies operating out of each site. These sites are intended to be a one-stop shop to ensure that youth and their caregivers do not have to travel between multiple locations to obtain services. The Amherst site is nearly ready to go, with additional sites nearing the final stages to open in 25-26. These sites offer youth between 12 and 25 a safe place to get support for mental health and addictions, and other things as well. Training and education, employment, social services, life skills, and recreation. At an integrated youth service site, youth and their families can access a range of different supports, all under one roof. The mix of services is different from community to community based on needs. What doesn't change is the approach. Everyone works together. Here's a few other things I like about this model of care. Integrated youth service sites are community-based, so they're closer to home. Some of them are open evening and weekend hours. There's no appointment required. People can drop in anytime and get connected with someone that day. And of course, there's no cost. No cost options, that matters, because when Nova Scotians need care, a price tag shouldn't stand in the way. That's why we fund so many important services and options throughout the public healthcare system, including nearly $7 million annually to Nova Scotia Health for supports and services across the province that provide medical care, trauma therapy, and domestic violence response support. Supports like the Sexual Assault Nurse Examiner Program, the Provincial Community-Based Sexual Violence Trauma Therapy Program, and enhanced domestic violence response and training for all points of entry into the healthcare system. These are part of a larger government response across various departments dedicating more than $100 million in continued supports to address gender-based violence and intimate partner violence. It is my sincere hope that Nova Scotians never need to use this service, but the reality is sometimes they need them when they are needed. Investments like these are crucial to ensuring Nova Scotians get the immediate care they need when they need it, while also helping them identify signs of risk and develop safety plans for dangerous and harmful environments. I want to talk about another important service we're invested in through the public healthcare system, and that's autism services. We've invested $31.4 million in services and supports for preschool-aged children with autism and their families. There's a high demand for these services, making these services available to everyone at no cost, again, as part of universal care. The Provincial Preschool Autism Services expansion is one of the ways we're helping address the needs of children with autism and their families. What it means is that more children and their families are accessing more programs and services sooner. It means having one point of access, one place families can go to access all of the services and supports available in the province and our public system through community-based organizations and beyond. It means ensuring the Quick Start Nova Scotia program for toddlers is available across the province. It means having autism intervention teams that will provide targeted, focused, and comprehensive services to children and youth with autism based on the needs of that particular child and their goals, which are developed in partnership with caregivers and families. It means increasing our capacity for diagnostic assessment. In 2023, we launched a pilot to connect children on the public waitlist for assessment with private practice psychologists with the training and expertise to conduct those assessments. 8 psychologists participated in the pilot, which helped us test the use of service codes to pay the private sector for delivering publicly funded healthcare services. And at the end of the day, nearly 200 kids were assessed. That's 200 kids who got care faster, which is very important, because our kids deserve to be set up for success. They deserve access to tools and resources that can improve their lives and their families' lives. We're also working with community physicians through Project ECHO, Extension of Community Healthcare Outcomes, a globally recognized approach to building capacity in the community for specialty healthcare services. It's a model that allows us to support community-based clinicians to further develop their own skills, and at the same time giving Nova Scotians better access to best practice care in their own communities. We have dedicated service codes in place that allow participating doctors to bill MSI for autism assessments through Project ECHO. By doing more assessments, we can give people better, more timely access to the services and supports that come after the diagnosis. We've also added resources to the team at the IWK and dedicating resources from the team to do diagnostic assessments. That's in addition to the recruitment we completed this past year for brand new clinical intake and care coordinator roles in our health system to support the Provincial Preschool Autism Program expansion. Of course, diagnosis is just the first step. We also recognize the need for better access to services and supports for children and families once they have a diagnosis. In 23-24, more than 1,000 preschool-age children received autism-specific services through Hearing and Speech Nova Scotia, a 20% increase over the previous year. Already, as of September, 656 children have gotten access to the services that they need. What this all means is that more kids are getting the support, the care, and the tools they need to help them thrive. The public healthcare system plays a critical role in supporting health and wellness of Nova Scotians. That hasn't changed. Government is delivering on universal care by providing more services in the public healthcare system. We're also leveraging the skills and expertise in community-based organizations, post-secondary institutions, and the private sector. That's why we amended the Health Services Insurance Act so we could establish new insured service programs to support the delivery of insured mental health and addiction services for everyone. Under Universal, all Nova Scotians will be supported, no matter what they're facing and regardless of their ability to pay out of pocket. Being able to work with private companies to provide new mental health and addictions programs is only one way that we're delivering on that promise. In this year's budget, we're investing $10 million in funding to support our very first insured service program for mental health and addictions care. And this month, we took a major step forward with the announcement of our next step towards publicly funded, privately provided services for mental health and addictions care when we issued a request for proposals to secure a billing administrator for the program. Between now and the spring, we will be identifying the professionals, including master's level social workers, master's and PhD psychologists, and registered counseling therapists, to provide non-urgent mental health care for eligible Nova Scotians experiencing mood and anxiety disorders. Although a lot of work is happening behind the scenes, there will be no cost and no new steps for the person and people accessing care through this new support. There's still one phone number people can call, and it hasn't changed, and it's the provincial intake line. This will be a great opportunity to connect with existing private sector clinicians in this province who are keen to help. We're all very excited. I'm very excited. This program is the first of its kind in Nova Scotia. There will be a phased rollout starting in the spring. And when we launch, we will be testing, trying, and improving as we move forward. At the end of the day, the most important thing is that people will be able to receive the care they need faster while alleviating pressure on the public health care system. Private sector partnerships isn't a new idea. They're already happening, like Access Wellness, which we launched in 2022. It's a single session counseling service for individuals, for families, for couples. You can meet with someone online, by phone, or in person, depending on what you need. It's free of charge for all Nova Scotians. Access Wellness offers a quick and easy, low-risk, low-barrier path to a service, therapeutic counseling that a lot of people have never considered before. Is this one program going to meet everyone's needs all the time? Of course not. But in a universal system of care, it doesn't have to. Because it's just one of many services and supports available to Nova Scotians. For some, a single session with a clinician is going to be enough for right now. For others, it might help them see the benefit of a service like this to support their mental health. Services like Access Wellness and the many others we've launched since 2021 are helping fill gaps in access to mental health and addictions care and building a universal system. I've talked to the public, I've talked about private, and now I'm going to talk about the work of community-based organizations who play such an important role in our communities. This past year, we completed the implementation of a community wellness framework. Until recently, many of our funding to CBOs was done on a year-by-year basis, which you can imagine made it very difficult for those organizations to do long-term planning. This funding framework is helping us align the needs of Nova Scotians with the programs and services offered by CBOs across the province. Not only that, but by transitioning to more multi-year agreements, we're actually giving the community sector something they've needed for a very long time, some stability. So they can spend more time on the actual services delivery and less time doing paperwork for grant applications. This past fall, we announced nearly $4 million over 3 years for community-led crisis response model led by a community-based organization known as POSSE, Peer Outreach Support Services and Education. The funding for POSSE means West Hants will have access to more mental health and addictions crisis supports through community-led interventions. And community-led intervention is an important level of care to offer, especially when people are having a mental health crisis. But a response from law enforcement isn't necessary. Through this program, teams will be available 24 hours a day, every day of the year. Staff will be trained to safely respond to mental health and addictions crisis, providing both in-person and virtual services for non-violent situations, like helping to de-escalate and stabilize a person in crisis, substance use intervention, wellness checks, and connecting people to other services and supports once they are stabilized. This is a local initiative. For it to be successful, it has to work for the people in the community, and it has to be connected to the frontline first responders. That's why local planning for this new model is so important and is underway with police, justice, health partners, and public safety at the table. This program is estimated to launch this fiscal year. Although mental health crisis and response don't always require a response from law enforcement, the reality is often police officers are in situations where they're interacting with someone who is in crisis. Again, part of the universal care means we have the whole system approach. This includes those on the front lines as well. That's why this past fall we hosted crisis intervention training for law enforcement and mental health and addictions professionals. The goals of crisis intervention training are to help police officers and others provide a compassionate and effective crisis response that is the least intrusive that it can be. I'm pleased to share that this training is helping the Glasgow Police. They shared that 74 consultations provided by the Crisis Intervention Training Service, only 4 required a visit to the emergency department. That is 74 people in the community who police were able to respond to and provide an informed crisis response, backed by compassion-based training. Another key piece of the puzzle when it comes to universal care is our work with academia, and we do that in a few different ways. Post-secondary is key to ensuring we have the workforce we need to deliver care to Nova Scotians, not just today, but also into the future. Last year, I shared that we'd be supporting Atlantic Canada's first Master of Nursing, Mental Health, and Addictions program. This fall, the program accepted the first students at Dalhousie University. I'm excited for them, for all they'll learn and all that they can do. This is just another example of a way that we are growing our healthcare teams right here in Nova Scotia. We also have this new Center for Psychological Health at Dal, where PhD-level psychologists are providing care to some of the most vulnerable Nova Scotians. The students are getting important hands-on clinical experience under the guidance of registered psychologists treating clients who really need it. From June 2023 to January 2025, the clinic saw nearly 500 clients. Not only is this a success for those people needing the care, 47 students are getting practical experience in their field of study here in Nova Scotia, which has tremendous value in building a strong pipeline of future practitioners. Now, I've shared a number of ways we're strengthening this province's mental health and addictions care, creating universal care for all, using technology to connect people with more tools and resources and better access to virtual care as part of that vision. That's why we collaborate with Nova Scotia Health, IWK, and other government departments, including departments of advanced education and justice, to develop a coordinated, integrated, and efficient e-mental health and addiction system. These programs provide a range of digital tools and resources, making mental health support available anytime, anywhere, for youth and adults across Nova Scotia, providing services to Nova Scotians with mild mental health and addiction services. These programs deliver accessible, evidence-based mental health support through digital and virtual platforms, addressing a wide range of needs from crisis intervention to long-term self-help. The services through this online system are not to replace other mental health and addiction services, but they do complement them. It's another option for services within the stepped care model, so people can access the right level of care with the right provider. Another example of using technology to reach more people is the Nova Scotia Health virtual crisis and urgent care supports. These virtual services are now available to emergency departments in eastern, northern, and western zones. A virtual option means improved access to crisis supports in rural areas. It's like anything we've had before. It means that after hours, when there may not be an in-person mental health clinician on site, emergency departments can still do crisis assessments. It means more care for more people in crisis, regardless of where they live. It means 445 virtual visits happened from last spring until this past December. As we move ahead this year, we'll keep looking for ways to use our resources in the best way possible across the system. When it comes to universal care, the third and final piece of the puzzle is system integration. These are the investments and initiatives that are necessary to ensure we're bringing all these pieces together into one cohesive system of care. The work we're doing on integration now means that when someone gets connected to provincial central intake, whether they're referred by a primary care provider, or they self-referred, or a clinical team does an assessment, they can then connect them to any one of the services I've mentioned today, in the public sector, private sector, through community-based organizations, or through virtual care. We want to match people with the most appropriate service for their need, and to do that, we need to make sure those care pathways exist between services. The right service from the right provider at the right time. That's what universal mental health and addiction care looks like, and we need a strong workforce to do it. That's why we've invested $7.6 million to support our Health Human Resource Plan for mental health and addictions. We know that under Universal, we'll be delivering more care to more people. And to do that, we need to make sure we have not only more clinicians, but overall the right resources in the right places. This funding is going to help support recruitment and retention throughout the system. Psychiatrists, nurses, psychologists, and social workers, just to name a few. It's helping create more jobs in provincial intake to improve responsiveness and get people connected faster. Plus all the non-clinical roles that support the delivery of mental health and addictions care, like peer support, engagement, outreach, administration, and more. It'll help us add more seats in our healthcare-related post-secondary education and training programs, and it'll help advance retention initiatives too, so we're supporting the workforce we have today and keeping our new recruits in the system long-term. And we've been making progress. We've recruited psychiatrists, added 8 clinical psychiatry assistant positions to support teams in northern and eastern zones, opened a new school of social work at Cape Breton University, created a new Master of Nursing advanced practice in mental health and addictions. This coming fall, a new clinical residency program is set to begin at Dalhousie University. We're finding solutions to meet today's needs, to build a workforce, and train the next generation to support our future needs. By the end of this fiscal year, with our first insured mood and anxiety disorder service getting people care faster, with 12 new recovery centers opening and helping people throughout the province, with 4 new mental health acute day hospitals, with continued focus on more care for more people faster, and a workforce action plan. We will continue to provide a range of options for all Nova Scotians needing care to deliver on our commitment of universal mental health and addictions care for all Nova Scotians. To do this, in total next year, we'll have invested over $363 million into the system, which means more services will continue to be more available, more quickly to more people in more locations. This is really complex work. There have been a lot of moving parts, but it's happening. We are making it happen, and people are already benefiting. We owe it to Nova Scotians to continue to deliver, but we can't do it alone. We're working with partners in the health system and the private sector, our community-based organizations, our universities and colleges, and many more. So I just want to thank my folks in my department here for today and for all the work they've been doing on behalf of Nova Scotians. And since we started working together in 2021, we've consulted with more than 200 stakeholders for universal health system partners, post-secondary institutions, community groups, regulators, colleges, professional associations, unions, Indigenous communities, and many, many more. The team has overseen expansion in our public healthcare system. They provided funding and guidance to community-based organizations. They built brand new, innovative pilot projects from scratch. This is really hard work that's connecting people to care, which is most important to me. And as a government, we owe Nova Scotians focus and action on the things that matter most to them. We know Nova Scotians want action to improve healthcare. We will continue to address healthcare over the next 4 years with the same energy and level of activity as the last 4. We've accomplished quite a lot. We're getting things done, and we need to keep getting things done. With that, I'll take some questions. Thank you, Mr. Chair.
Thank you, Minister Comer. According to the practice that has developed in this legislature, the opposition caucuses take turns asking questions for approximately 1 hour each. During a caucus's turn, the members within a caucus may take turns examining the minister on estimate resolution. Only the minister may answer the questions. Caucuses are expected to share time fairly with the independent member. To begin the examination, I now recognize the official opposition and turn it over to, the member for Halifax, Citadel, Sable Island.
Thank you. So thank you very much for that overview. And I mean, as you know, I'm passionate about mental health and I'm passionate about better mental health for Nova Scotians. That's why I decided to run for politics. This is why I'm in this game. So I'd like to start by talking a bit about the universal mental health pilot with private providers. So, I think the first thing I wanted to ask about, I was surprised actually that the intent is to have like a private sector administrator for that program. I'm really concerned about overall the capacity of the public system and the health of the public system. And so I'm wondering why we're not building that capacity internal to government. Is this related to an expectation that perhaps mental health demands will diminish over time? Or, just what's the rationale for that, not making it in-house function?
Mr. Comer?
Yeah, it's a good question. So I think the specific question with the billing administrator is really for the billing mechanism for clinicians to build the province for publicly funded care. We know that there's about 790 private clinicians across the province for a variety of different reasons why they're private. I would say since the announcement, we've had a significant outreach from people across the province expressing interest to participate in this program, which I think is a really positive thing. I think if you look at the 4 health zones across the province, there's still very much active FTEs for posting for psychiatry, for nursing, for all kinds of allied healthcare professionals. I think I talked about there's over $7 million in the health and human resource strategy for the public system still that's ongoing active recruitment. I think there will be situations where we'll have clinicians that might do this on a part-time basis too. We had a number of clinicians reach out those, which I think is probably a positive thing. I would say the vast majority of the money will be used for clinical services delivery, but where it's a brand new service, we do need to build the foundational infrastructure to bill the province essentially. So, and I think another important piece is to have that one access point, through central intake. And the billing system will essentially be very similar to the MSI system, so it's very clear and straightforward, I think, for Nova Scotians to use the system. So I think 90% of the money has been spent in the public system. I think the non-urgent waitlist specifically has been I would say a chronic problem in the province, right? So this is really just a new lever to pull for non-urgent that aren't meeting that 28-day benchmark, I would say. Thank you.
I recognize the MLA for Halifax Citadel, Sable Island.
I wanted to ask a bit about consultations with current service providers. So I know that there was a couple of online engagement sessions last week with current providers. One gathering, I think, was over 500 folks from across the mental health system. And I'm wondering, how do you feel these sessions went? Do you think you have the support of the sector? And what concerns were raised?
Mr. Comer?
Yeah, so I spent a lot of time at first, especially a couple of years, traveling across the province to different hospitals, different kind of stakeholder engagement sessions. There was a number of town halls. There was one, I think, last week or the week before. I think, there's, whenever you do anything big and new and hard, there's going to be some questions and concerns, which I think there certainly was some good questions on the call surrounding, just some logistical questions, how the program actually works, with some questions about how we're going to continue to invest, I would say, the public system, how this will integrate with central intake was another point that was brought up. So there were some very positive comments. There were some concerns that we kind of took back to the department, which we'll certainly follow up with them. So yeah, I think there were some questions too about, will this draw people out of the public and private system? How will that all work? I mean, there's certainly, people leave for a lot of different reasons, I think, right? I think we've shown with, our collective agreements with various healthcare professionals that we're very fair in compensation, and those certainly conversations will be ongoing. But that was, I thought it was productive. I certainly see it as an ongoing process as things kind of roll out. So I'll be happy to participate in more of those and take that feedback. Yeah, take the feedback.
Minister Comer, after the next question, Ledge TV is asked if you don't press the button, they'll go ahead and do it, okay? Yep, okay. Thank you. I recognize the MLA for Halifax, Sidney, Sable Island.
Getting better at it. So, I mean, I guess, you know, I was actually contacted by a number of people in a number of different roles following the engagement sessions last week. And overwhelmingly, what I heard was quite negative. And they reported that overwhelmingly, that the approach was really panned. And I don't think that should have been a surprise because, you know, I brought letters to the floor of the legislature before from every child and youth psychiatrist in Nova Scotia wrote you and the Premier last year. We've tabled that before. I can get it for later. You know, and that letter went unresponded to until I brought it to the the floor of the legislature. And basically, people are raising the same concerns. So they're really worried that that this is going to result in a drain from the public system. You know, and so particularly in this program, you know, folks in the public system often have restrictions on, you know, how much time they can spend with people, the length of treatment, and their actual salaried positions, competitive or not with other salaried positions, are going to be pay much less than a private provider is going to bill for. So I think there are actually really challenging health human resource concerns here. So I guess I'm wondering, how are you going to deal with that that disparity between salary versus what people are able to bill through the system?
Mr. Comer?
Thank you, Mr. Chair. Yeah, so I think there's been a lot of attention on the health services insurance kind of program that's going to be rolling out, which I think is a good thing. But I would say, like as I kind of stated before, 90% of what we've spent so far has been in the public system. There's the majority of the investment will continue to be in the public system. That certainly isn't changing. I think, you know, being able to use billing codes in the province for healthcare to publicly fund healthcare is nothing new. It's new for mental health care, I would say. I mean, in terms of compensation, those certainly conversations will be ongoing through, you know, the procurements. I would say that the pilot that, you know, did over 200 diagnostic assessments with the 8 psychologists, I think was quite successful. You know, which is we're seeing some access to autism services that I don't think we've seen in the past, which I think is a good thing. So I think, you know, if you look at people choose to work in the private sector for different reasons, lots of different reasons. So we'll ensure that the compensation is fair and reasonable. I can't comment on specifics today because the procurement hasn't been posted yet, but those conversations will be ongoing. I'll certainly welcome feedback. I would say there has been a significant amount of positive outreach as well from clinicians, like in the last couple of weeks especially. So we did get a letter this week from the president of the community health boards for the province, which is very positive. Mm-hmm. So I can certainly provide that too. So there's been a lot of positive outreach. There's been some concerns, and we'll work through those. And I think, you know, having worked in the healthcare system myself, when you do something new and it's a big change to your practice and your routine, there's certainly challenges, but we can work through that, I think, together. Thank you.
I recognize the MLA for Halifax, Sidney, Sable Island.
So you noted that there were 790 private clinicians sort of within your catchment and potentially for this program. How many of them also work for the public system as well?
Minister Comer?
I don't have that specific information. Yeah.
I recognize the MLA for Halifax, Sidney, Sable Island.
So in this program, if there are public clinicians who also want to, who work or want to work as private clinicians, will that be permitted? Is there going to be a minimum commitment from private clinicians to be part of the program?
I recognize Mr. Comer.
Yeah, I don't see why that would be a barrier. I would say those specific details are being worked out. A big part of certainly my focus is the measurement-based care piece. So each person that would be wishing to participate would have, specific, software and infrastructure provided to be part of the measurement-based care system, very similar to what the IWK already uses. So I don't see why that would be a barrier if the part-time clinician want to do that works with the public system. So I think the goal is to start with around 50 to start off. We can't do it all at once, so we'll have to be strategic to geography and vulnerable populations and all these sorts of things. But I certainly don't see why that would be an issue.
I recognize the MLA for Halifax, Sidney, Sable Island.
I mean, I guess the concern that's been raised to me and the concern that I would have would just be, again, I'm simply sharing what stakeholders have brought to me, but the feeling that folks will be enticed out of the public system. But even in this sort of part-time role where folks are working in the public and then doing private work in the evening, I think there's some real concerns around clinician capacity, burnout, and whether, essentially, eventually people will want to move into the private sector altogether. You mentioned about measurement-based care, so I think this is, I think I would use evidence-based therapies, but I think it's perhaps the same thing. So I guess I wanted to talk a bit about patient quality and safety. For a long time, mental health has been like the poor cousin of sort of physical health in terms of access and implementation of evidence-based therapies. So, the old examples of you go to the ER with a broken arm, you pretty much know kind of what the steps are going to be to diagnosing that and dealing with it. I know there's been lots of work done, but I think we're still in the place where, that sort of consistent approach to delivering evidence-based mental health therapies isn't there across the system. So when I look at the UK model, when they expanded to their universal mental health care, they actually developed a program called the Improving Access to Psychological Therapies program. And so everybody who was able to work for the public system as a mental health clinician had to be trained in one level or the other of these. There was several levels. And they were evidence-based therapies that the government recognized as such, for depression and anxiety. And then, the clinicians were all provided with psychologist supervision and mentors, and they collected clinical outcome data on 98.5% of patients. It was also shared publicly. So to me, this seems like a great example of thinking through, you're going to have a wide variety of folks, like you've said yourself, like MSWs and other folks who will have come from very different training and education backgrounds. So how will Nova Scotians know that they're getting an evidence-based therapy, and how will you monitor that?
Mr. Comer?
Yeah, so actually I had a chance to go over to the UK to met with Dr. Clark for a couple days and to learn more about that program. It was very productive, I thought. So it's increased access to talking therapy, I believe, is kind of psychotherapy, whatever the acronym is, IAPT, I think. And so he's, I think, did some transformative work in the UK for sure. Using evidence-based care and performance-based measurement, which is something we certainly talked about when I was over there. I would say when they kind of started the program over there, like based on my conversations with him, there was certainly challenges getting it started with going in with experienced clinicians and telling them they're going to have to do things differently through it, the curriculum that they kind of administer through clinicians, which is, I think, is an interesting point. I think in terms of the universal access to care here, the measurement-based care system is really using evidence, monitoring evidence-based therapy, but also takes into account, patient feedback, self-assessment. They monitor their own progress as part of the therapy. There will be, ensuring clinicians have, adequate credentials and whatnot through the procurement process as well. So you really get to review what the clinicians do, and we also get to see what's the patient feedback. Do they feel like they're getting better as well? And to monitor progress, not just from a patient feedback, but also from, an objective feedback, right? To see if it's also kind of, correlating. Thank you.
Excuse me, I recognize the MLA for Halifax, Sidney, Sable Island.
And I guess, what I would say is that, obviously that's a change management issue that they identified in terms of working with experienced clinicians and moving to evidence-based practices. But I don't think experience equals evidence. I mean, I think that's part of the challenge, right? So folks might have lots of experience in different ways of providing counseling, providing talk therapy, but if they haven't been using evidence-based therapies, I guess I'm wondering sort of like, what's the expectation going to be for how people get started? Are people just going to be able to continue whatever approach they've developed and used as a private clinician over years?
Minister Comer.
Yeah, I would say I know we've developed service codes specifically, like for evidence-based treatment modalities, like CBT, for example, or DBT, depending on the specific the treatment. I don't have the service codes here with me today, but we can certainly follow up with that. So I guess the answer would be that there's a finite number of things that are evidence-based modalities that are already used in the public system. So that's one piece of it, and I think the other piece would be the outcome measurement-based care. So it won't just be you can pick any kind of therapy you want out of thin air and do it at someone's home type of deal, right? That's the whole kind of, I guess, the point. So I'm really focusing on the mood disorders and anxiety to start, because that's where the biggest need is. So I think it's always tough when you're doing something new like this. I think the UK kind of ran into similar sort of situations early days as well. But having the evidence-based care with the outcome measurement-based care as well I think that's the best way to do it. Thank you.
MLA for Halifax, Sidney, Sable Island.
And so what is the measurement-based care, measurement-based therapy that you're going to be using, or the tools that you're going to be using? Are we talking about, evidence-based assessment tools that people would run through on a regular basis?
Minister Comer.
So yeah, just a couple points, I guess, here, just about evaluation and monitoring. So I noted before that we'll be using implementation of measurement-based care. Also, kind of some can be referred to as routine outcome monitoring. So using real-time client feedback, self-assessment, monitoring progress through clinical treatment allows both the client and service provider to review progress, which is important. So Nova Scotia Health and IDVK have been implementing measurement-based care within their mental health and addictions program for quite some time now. So this will also be implemented with future insured services programs as part of the rollout. Some of the indicators that are typically monitored can include. That's just something different. Sorry.
I recognize the MLA for Halifax, Sidney, Sable Island.
And so within the public system, so through the IWK and through Nova Scotia Health, what percentage of appointments or clinical, I guess, relationships are being measured? Because the last time I had a chance to look at this, certainly, the IWK was doing more measurement than NS Health was doing for children and youth in the other regions of the province. But even within that, like the actual amount of data collection was actually relatively low in terms of, if people stopped coming to their appointments or to treatment, like we weren't actually following everybody to the end of their clinical relationship. So do we have a percentage number of how many people / appointments are assessed?
Mr. Comer?
Just to clarify, is this for the child and adolescent space, or is it just in general?
MLA for Halifax Central Stable Island, please.
So, I mean, the system that I know better is the child and adolescent space. So what I have understood is that, yes, at the IWK there's been an attempt through their clinics to do, more measurement-based care, but that even in the community clinics, that's not always successful, depending on whether people complete, a planned treatment process or that sort of thing. And then I also understand that this is not really being collected by Nova Scotia Health when treating children and youth outside of the IWK system. So with that, what I'm wondering is, like, what's the percentage that we're getting now? And then I'll just give you my follow-up question at this point. But, like, how are you going to make sure that information is being collected from the new program?
Mr. Comer?
Yeah, so for IWK, about 90% of the clinicians right now are using it. I think they're also trying as best they can to get 100% of people that use their central intake to also utilize this too. I think IWK also is responsible for about 70% of child and adolescent services in the province, and Nova Scotia Health is 30, I guess you would say. But there's lots of conversations that kind of occur between those two groups. But as part of Nova Scotia's Health current conversation, I guess you would say, or agreement, they would be obligated to use this for 100% moving forward. Yeah, thank you.
I recognize the MLA for Halifax Central Stable Island.
In the announcement, last week or the week before, I can't remember when. So, there was a model of how referrals could go back into the public system, and then also talking about referrals to community-based partners. So maybe I'll talk about how that process is going to work going back into the public system. So, as you said, you're starting with sort of like mild to moderate anxiety and mood disorders. But if people haven't had treatment, I mean, that's kind of, this through central referral, but, if they haven't seen a clinician, actually, you might get to an appointment and realize that something else is going on or that additional services are needed. My personal example is, while we were waiting for IWK mental health, and this was a long time ago when the wait list was much longer, we ended up going to a private psychologist, but then when we wanted to see psychiatry, we ended up way back at the beginning of the list again. So even though our doctoral level trained psychologist was like, you need a psychiatrist, we had to then go back into the waiting. So I mean, that's just a very concrete example, but I'm wondering, so how will referrals back into the public system happen? If someone gets through central referral, they get referred to a private clinician, the private clinician is like, ooh, actually, you know what? I'm not comfortable with this situation, or I think you need more intensive therapy or support, or you need to see a psychiatrist, how will that happen?
Mr. Comer, please. Sorry.
That's okay. Yeah, that's a good question. I think if you think of, it can be very complex cases that can either, people get sicker, they get better, it kind of can fluctuate. I think Nova Scotia is fortunate. We have a really robust central intake system. There will be enhancements to that system in terms of staffing as well, for sure. Also trying to modernize the intake system will also be certainly be a focus. So the mechanism will be through intake.
MLA for Halifax Civil Stable Island.
So just to clarify, a Nova Scotian has been seeing a private clinician through this program. Either they or their clinician recommends that they seek a different level or type of treatment. Is the patient, is the only way the referral comes through is the patient contacting central referral, or will the clinician have a role in that?
Mr. Comer.
Yeah, I think that for the transfer of care specifically, it would be the clinician. I think would have some significant input, but the patient can also self-refer, right, to intake as well. So, but that would certainly be a good question. It certainly will come up. That's why I think it's really important to have those robust supports in central intake, because we're going to also need to have mechanisms to possibly, to admit someone to hospital too, right, and these sorts of things. So, the communication will be important, especially the transfer of care, the care process. But we have some really great staff at intake that I think are doing some great work, and I think that additional support should make a big difference. I think. Thank you.
I recognize the MLA for Halifax Civil Stable Island.
And so you've talked about the role of central referral. How is that work monitored? So how do you assess the accuracy of the assessment that's done over the phone with folks through central referral? And you've talked about strengthening the service. Do you have an estimated number of FTEs that you're looking for?
Minister?
Yeah, we'll try to track down the specifics with the FTEs as we're kind of talking here, but yeah, I would say the typical intake referral takes about 45 minutes. So these are highly trained people on the phone. We know, I think there was about 17,000 intakes last year as an example, but there was a much higher call volume that didn't require intake. They could require 211, or they could just could be something just different that doesn't require an intake. So that the response times are always quite good too with intake workers for call volume. So there'll be significant enhancements. I know there is a lot of work being done there now to modernize it as well. So I think that's important work kind of as we move forward. Oh. So it's 22 FTEs.
I recognize the MLA for Halifax Civil Stable Island.
So just to clarify, I'm gonna ask two follow-up questions at once, so we minimize the passing back and forth of the mic. So is that 22 new clinicians for central referral in particular? And then my other follow-up question is, certainly numbers of calls, length of calls, I mean, that's kind of at the output level of measurement, right? Like we can count it and, that sort of thing, but it doesn't say anything about the quality and accuracy of those assessments. So I'm wondering how that is monitored and measured.
Mr. Comer?
Yes, the 22 would be, that's an increase of 9, so an increase of 9 FTEs. In terms of the quality, we can, we'll have to touch base with Nova Scotia Health, and we can try to follow up with that specific quality control piece, and we can follow up with that. Thank you.
MLA, I recognize the MLA for Halifax, Sidney, Sable Island.
As well, in the announcement, there was a discussion of, the other potential referral from the private clinicians in this program could be to community-based organizations. And so I have a lot of questions about that. So how will clinicians know what community-based organizations and services exist, in their region or in their community? Or if they're online, like how will they know what's available for folks? You talked about the long-term funding agreements with community-based organizations that you've undertaken. So would the clinicians be encouraged to refer to community-based organizations that are supported by that public funding, by that long-term funding, or will clinicians, sort of be able to refer to anyone? And how will that be monitored, and how will those, sort of outcomes be monitored and that sort of thing?
Mr. Comer?
Yeah, I would say folks in the department have done a lot of work with the community wellness framework, so we've spent a lot of time kind of traveling across the province, meeting with different groups right from Yarmouth to Cape Breton. So we're in the final stages now of negotiating different contracts with different groups across the province for 3 years core funding, right, for a lot of these groups. And there's groups that are geographically everywhere, so that do really good work. So once that's finalized and announced, I mean, that information would certainly be made available to clinicians that would be participating. But I would say it wouldn't just be, even things like, the Access Wellness and the peer support phone line, like the continuum of care. I think that would be, there'd be a suite of resources that would be offered to participating clinicians and just people, right? So, but I think those groups had really strong applications, I would say, and do really good work in the community. So they'd be a good starting point, I would think. So that would be where I would say, yeah. Thank you.
I recognize the MLA for Halifax, Sidney, Sable Island.
Yeah, and I guess, I have sort of concerns on two sides about how working with community-based organizations. So one is, basically relying on community-based organizations to sort of fill in perhaps where government isn't, or where resources aren't, and that sort of thing. And so making sure that community-based organizations have that sort of long-term funding arrangement, and that they have the capacity to be part of the system. And then I also, on the flip side, I think there are still sort of patient safety and quality issues to consider. So again, clinicians can refer anywhere. How are you going to track that they're referring to, sort of appropriate service providers?
Mr. Comer?
Yeah, I wouldn't see this being a situation where, that they're getting a clinical service and being referred to as, CBO for another clinical service. I would see it as they're probably getting to a point in their care path where they're starting to feel better, and this might be just a lower tier level of support. I think if you look at the Center for Psychological Health, for example, at Dowell, and most of their referrals come from community-based organizations in HRM, right? So they come to whether it's the CMHA or whatever it is, there's different groups that and they kind of just can walk in and start their kind of assessment with the resident psychologist, so which is good. I would kind of see it working more like that. If they need additional supports around like food security or employment or those other sort of things, that's how I would kind of see probably that working. But I think the CBOs could play an important role for the centers like the Center for Psychological Health, just as an example. Thank you.
I recognize the MLA for Halifax Central Table Island.
And I'm wondering about the governance of this program. So, because it is not necessarily fully sitting within the public sector, if we're going to have a private sector administrator and working with clinicians outside of the public sector, will there be an ongoing advisory council created?
Mr. Comer.
So yeah, we do have an advisory group like for Universal in general, like which is a lot of first voice and sort of community folks across the province. In terms of the HSIA kind of rollout, there'll be a clinical coordinator, which will be within the government, and there'll also be like very specific accountability arrangements through the procurement and stuff like that. I can't really talk about that too much now because it hasn't been posted yet, right? So, but there would certainly be an expectation of accountability for sure. Thank you.
I recognize the MLA for Halifax Central Table Island.
And what about organizations like the Nova Scotia Psychologists Association or the Nova Scotia Board of Examiners and Psychologists? Are they involved in an advisory capacity for this rollout, or any other professional organization?
Mr. Comer.
Yeah, no, I've been meeting with them periodically for a couple of years now, just as we're kind of working through this. I know those conversations continue to be ongoing. I would certainly expect that they continue to be ongoing kind of as things roll out. But they'd certainly be a key stakeholder, as would the other kind of health regulatory bodies. Thank you.
I recognize the MLA for Halifax Central Table Island.
So I do have questions about the RFP. I understand it's not posted, so I'm going to ask my questions, and ideally if you could share what's available. And also, when it's finally posted, perhaps you could follow up and then answer these questions once it's available publicly. So what specific tasks or competencies is the RFP asking for? And how will you assess the performance of that independent contractor?
Mr. Comer.
Yeah, so the procurement that's posted now is for the billing administrator, so I can't comment on something that's not even posted yet as a procurement, right? So I'd be certainly happy to follow up once that's closed.
All right. I recognize the MLA for Halifax Central Table Island.
And so what are the timelines that you're aiming for? I understood from the announcement that the program would be operational on April 1st, so does that mean that the administrator would be in place? When do you think the RFP will be posted?
Mr. Comer.
Yeah, I would say there'll be I think 2 more RFPs posted in the coming weeks, so that the expectation would be by spring. Yeah, thank you.
Recognize the MLA for Halifax Central Table Island.
Maybe this is some of the conversations you had in the UK when you went over to look at the IAPT system. Certainly there's a Mental Health Commission Canada 2017 report on universal psychotherapy around one of the challenge areas is around equity. So a universal system, some of the challenges have been that then it doesn't bring forward folks who have clinical or community expertise with diverse populations. So the recommendation from the MHCC, the recommendation in the UK and in Australia is around targeted programming to achieve equity. And so I'm wondering, how's that going to work within this program?
Mr. Comer.
Yeah, definitely a good point. We know there's inequitable access to care for sure. So we've been working hard with African Nova Scotian communities and Indigenous communities. So I think a good example is the People's Counseling Clinic here at HRM, which I think has been a really good partnership with the department. We've also done a lot of work with the IWK, really trying to improve Afrocentric models of care for youth, really trying to encourage access to culturally supportive mental health care. We also do a lot of work with Tijikamic, that work continues to be ongoing as part of the First Nations Health Authority kind of moves forward. And also one of those, a group of those First Nations communities are going to be part of the Integrated Youth Services model as well. So there certainly has to be a key focus, I think, on also with training for mental health clinicians as well, and culturally appropriate care. And there is also a lived experience advisory group that we kind of liaise with. They're comprised of CBOs from across the province. We'll also have diverse perspectives and individuals on those on that committee to give us advice on delivering services to their communities. Thank you.
I recognize the MLA for Halifax, Sidney, Sable Island.
So you mentioned the increase of delivery of Afrocentric services with the IWK. Can you tell us a bit more about that? So, like, how many clinicians do that work? How is it evaluated? How many patients have been seen?
Mr. Comer.
So yeah, this part of this work was so there's engagement completed with historic African Nova Scotian communities who really were telling us they weren't getting access to culturally appropriate care. So the team through the IWK started accepting external referrals. That was in 23-24. So it's fully operational team. So there's 5 FTEs. So there's a rec therapist, an occupational therapist, masters of social work and nursing. And the team reflects the communities that they serve. So they're really focused on direct client care, helping folks navigate the system to see what they need. Mental health literacy, proper training for mental health clinicians and Afrocentric approaches. So I know some of the key kind of stakeholders for the community partners were Hope Blooms, the Youth Project, the Brotherhood and Sisterhood, HRM Recreation, recreation centers in Lucasville, Hammonds Plains, and East Preston. So I know there's been an evaluation framework that has been completed, but I don't think we have that. I think that might be with the IWK, but we can. Oh yeah, so there's just a bit of I guess metrics. So from April 2024 to December 2024, there was 213 appointments to 34 unique clients, 154 clinical consultations, and 18 orientation and training sessions. So also partnerships with 7 community-based organizations, most of the ones I just kind of referenced to. Thank you.
I recognize the MLA for Halifax, Sidney, Sable Island.
And then moving out of the child and youth space, so I want to talk about the Desmond inquiry and the implementation of those recommendations. So, I think the commitment was around community-specific virtual care. Is there increased community-specific virtual care? Who is it being delivered by, and how is it being measured?
Mr. Comer.
Yeah, this is an important issue for sure. That's why I think it was really important for us to have that advisory table consisting of people from across the province, different diverse backgrounds. I would say with the eastern zone or eastern region of the province specifically, for many years there's been significant deficiencies in the number of psychiatrists, for example. So we have, I believe, a full complement now of psychiatry in the Eastern Zone, which took a few years. It was certainly tough. There's also been they now have access to virtual psychiatry in the ER there now as well, which I think the pilot there in St. Martha's was actually the first hospital that kind of started that program. Certainly continue to work to build trust within the community. I think in that area, it's certainly a complex. Traumatic issue, I would say, for sure. So, and there's also, I know, work being done in a variety of other government departments. And we're still looking at opportunities how we can better expand more culturally appropriate care, especially in rural parts of the province for diverse communities. So we're certainly continuing to do that work. Thank you.
I recognize the MLA for Halifax, Sable Island, with about 12 minutes left.
I think I'll turn then to some questions about federal funding that has been targeted to mental health in Nova Scotia. And I do have my document to table. So, the Canadian Alliance on Mental Health and Mental Illness and Mental Health published a report called Take the Money and Run, trying to understand, with the two allocations from the federal government for mental health, sort of how provinces and territories have spent it. So, in 2017, the federal government provided $5 billion to mental health to the provinces and territories. And then in 2023, under the Working Together to Improve Healthcare, there was $25 billion that included an expectation that mental health would be a component of that. My understanding is from that 2023 funding, Nova Scotia invested 18.8% of that funding to mental health, and that is above the median for other provinces and territories, but that it had been planned to spend 29% of that federal funding received for mental health, and I'm wondering why didn't that happen?
Mr. Comer.
Yeah, I'd have to look at that specific report and look at the numbers to get into the specifics, but certainly my understanding was any of our allocation was certainly spent on transformation of mental health care in Nova Scotia. We can try to get a specific number from for that and follow up with the member, if that's okay. Thank you.
I recognize the MLA for Halifax, Sable Island.
And I have some other questions about, what was committed to access that federal funding and what's happened. So, provinces and territories were asked to commit to lower median wait times for community mental health and addiction services. And Nova Scotia's goal was moving from 22 days to 20 days. The 20 days target is the lowest amongst the Atlantic provinces, but more than some other provinces like Saskatchewan. So why is our target 20 days, and have we met it?
Mr. Comer.
So I think for crisis, obviously the target is immediate, but I think for urgent care, it's typically 7 days. For non-urgent care, it's 28 days. That's kind of based on national benchmarks, basically. So I'm not too sure of the 20 days. So maybe just get the member to clarify that for me. Thank you.
Sorry. The member for Halifax, Sidney, Sable Island.
So, I mean, again, I think if you're going to follow up on the numbers, the report's been tabled, and maybe you can have a look at that and just clarify based on the report. So, I can move on to my next question.
Please.
Okay. Are both sources of federal funding for mental health and addictions exhausted?
Mr. Comer.
So it's all been committed to mental health transformation initiatives, but we can certainly get the folks with finance to get specifics, and we can follow up if that's okay. Thank you.
I recognize the MLA for Halifax, Sidney, Sable Island.
You talked about the assessment pilot for autism and for ADHD. At the time that the pilot was launched, there was a commitment to the data that was being collected through that pilot to be shared publicly. And I'm wondering if that promise has been fulfilled, and if not, when it will be fulfilled.
Mr. Comer.
So yeah, the pilot is complete. I know there's currently an evaluation that's underway. So I don't have a timeline on that right now, but I wouldn't expect it would take too long, but I wouldn't have a specific date today. Thank you.
I recognize the MLA for Halifax, Sidney, Sable Island.
And is the commitment to still share that publicly? Because, part of that too was testing out working with private clinicians through the public system. So I'm wondering how what's being learned from that pilot is being used to inform the development of the universal mental health care program.
Mr. Comer.
Yeah, I think as the evaluation kind of gets completed, I wouldn't have an issue with telling people what went right and what were some issues. I think that's part of learning when you're doing something this significant. So there certainly will be learning from anything you're testing and trying. So we'll kind of learn as we move forward. But I do think it's important to do everything that we possibly can to give folks access to care that they can afford. Thank you.
I recognize the MLA for Halifax, Sidney, Sable Island with 5 minutes, 30 seconds remaining.
And so, with the pilot, even with the pilot, there are still thousands of young people on the wait list for autism assessments in particular, and hundreds on the wait list for ADHD assessments. So is there a continued increase in capacity in the public system to do these assessments? And if you could confirm how many young people are on the autism assessment waiting list and how many people are on the ADHD waiting list?
Minister.
So I guess just to talk a little bit about what we're trying to move forward with improving preschool autism services. So I think if you look at some of the new, like an enhanced evidence-based services that we're doing, increased capacity for clinical intake and care coordination, Quick Start Nova Scotia, which now is available across the province, direct intervention, early start, the Denver model, so ESDM, focused interventions, intensive interventions. We've developed, I think, a significant partnership too with Autism Nova Scotia and IWK Nova Scotia Health. So I'll just try to, I think we can track down the numbers, sorry. So we have the ASD, but I don't have the ADHD. So I'll give the ASD. So for preschool, it's 856 for 24-25, and for school age, it's 1,084. So the 856 for preschool is actually a decrease from last year, which I think is the first time in quite some time that's happened. The school age is not, that has increased. Thank you.
Recognize the MLA for Halifax Central Sable Island.
You've mentioned the Quick Start program a couple of times. So did it receive funding in the current budget?
Mr. Comer.
Yeah, just a little over 2.3 million. Yeah.
Recognize the MLA for Halifax Central Sable Island. 3 minutes.
Okay, I mean, I might only be planting the seeds for the next part of our conversation. Certainly the reduction in preschool age wait times for the ASD assessments is really important. But there are at least two other points at which, there's a rise in diagnosis of autism. And so one of those is sort of early adolescence, and then the other time is the sort of adult transition period. 11, 12, 18, 19 kind of thing. And we still have a significant number of school-aged young people on the wait list. So I guess I'm wondering how are you going to tackle providing support to school-aged folks who have missed the opportunity for any early intervention services, and so often require different types of services. And yeah, maybe I'll just stop there.
Mr. Comer.
Yeah, I know there's been a significant focus with the IWK to increase clinicians to have the ability to do the testing for school-age children. I know there's work certainly ongoing in that, but we have to probably get more specific with that program. Thank you.
We have 1 minute. Do you want to go? Or? Thank you. So I recognize the member from Timberley Prospect.
Thank you, Mr. Chair, and I'll be sharing some time with the independent member when she comes over. Just a few questions. It's been a while since I looked with much detail into the office, but I know you've been the minister for some time. Back in 2021 is when the office was created under a slightly different name. I just realized that the other day. It's just a little bit of a different order with addictions and mental health. But one of the priorities that the experts brought forward in terms of a gap to me when I was in a position to make these decisions was the withdrawal management hubs, they were known as. And I'm curious how that's going. I know the Dartmouth one opened in early 2022, and there was a lot of excitement around that. And then I think one on Fenwick Street, I believe they're called recovery outpatient centers now, if that's the same thing. But effectively, it really provided that service for Nova Scotians to either book an appointment or walk in to get treatment for withdrawal with addictions and issues related to a whole long list of different issues that they weren't able to get treatment for without going to Emerge. I think that there was a plan to have access for all Nova Scotians to get into these programs across the province. So I really don't have any detail of where that whole initiative has landed. Maybe you can give me some detail on where we're at today, how they're operating, how busy they are. Is it warranted to build more of them? Is there targets to make sure that we have enough of these across the province type thing?
Mr. Comer.
Yeah, so I think in terms of opioid use disorder treatment clinics, so they've been around for a while. We have, I think, 23 across the province. I think back in 2017, the province did a opioid use disorder kind of strategic plan, I guess you would say. Effectively, over the course of 5 years, got rid of the wait list for that. So the recovery support centers are actually something new and separate from these clinics. So there's the recovery support centers are really geared towards it can be gambling, can be substance use, it can be like therapy, these sorts of things. So you just walk in off the street. There's 10 of them open now. We're opening 2 more. There's one to open that's going to be opening, I believe, in Spring Hill and one in Amherst the next probably 3 months or so. They're good too because you don't necessarily have to build like new infrastructure, which is kind of nice. You can just kind of repurpose assets you already have. I think there's been around 8,000 visits so far to recovery support centers, so it's pretty good. The first couple opened up in HRM. Very positive, I think, from clinicians and from patients using the service. So yeah, I think it's a good thing. There'll be lots of access right across the province. You don't have to get a referral from your doctor or nurse practitioner. You can just walk in off the street, which is, I think, people like that too. And it can also be an access point to get you into the hospital system if you're sick and need that kind of acute support. So I think it's going well. People seem to like it. So I think it's a good thing. Yeah, thank you.
I recognize the member from Timberley Prospect.
Thank you, Mr. Chair. So I guess there's 2 more openings what I'm hearing. On the same kind of topic, this is kind of a local question in some ways, but my understanding is that the only place that women can go for addictions and which is gambling and substance abuse is in my area. It's called the Marguerite Center. My understanding is funding comes through, maybe it's the Department of Health directly and not the office, but certainly this is within your mandate. And in the past, they have spoke about a disparity between women having access and men having greater access. So they have about 12 beds. So this is programming that lasts from a minimum, I think, 3 months to a year. A really good programming, I think, is what I'm hearing. And so is this really the only place in all of Nova Scotia that women can access? And what is the disparity between women and men in terms of accessing the kind of service that the Marguerite Center offers?
I recognize the Minister of Addictions and Mental Health.
Yeah, so I had the chance. I was there. I met with she was a really great person, the lady that runs that facility. Had an opportunity to speak with a couple of the residents too. I think it's a great spot. So we do fund them, I think, about close to $370,000 per year for kind of operational funding. We fund 5 recovery homes across the province. One of them is for women, the other 4 aren't. So you're correct with that. So there's still always inpatient beds available for anyone that needs them, especially for any kind of withdrawal management issues. But this is a great spot. There's a couple other. There's another one in Cape Breton called the Hope House. That's not government funded. They're kind of doing their own thing by choice, I guess you would say. It's sort of a 6 to 12 month sort of stay thing as well. But they have kind of their own kind of way of doing things. But you'd be correct about Marguerite Place. But I do think they're doing some great work there for sure. Thank you.
I recognize the member for Timberley Prospect.
Thank you, Mr. Chair. And so that center's been operating for, at least longer before I was an MLA, so more than a dozen years. And I just, with all of the increasing issues related to addictions, certainly it's grown since the pandemic alone. Do you find it odd that there are more places for men to go to seek this kind of treatment, and just one in the Timberlea area that for all of Nova Scotia, or is the government taking a serious look at expanding service, either at the centre itself, which they've asked for, and I haven't talked to Lisa Mullen, this person you're talking about, for probably some months now, but I just find it odd that that's the only place that women can go for this. And I recognize you mentioned the other place in Cape Breton, and they're able to do it without funding, but do you think that's enough investment for women to access that kind of service in the province?
I recognize the Minister of Addictions and Mental Health.
Yeah, I would say, like, if you look at the increasing need and increasing demand in the province, I would say there's very active conversations right now within the department looking at this specific issue for sure. We really try to, encourage people to get support in their communities and with their support networks, but there's situations where you do need that kind of longer term, I would say, residential treatment sort of care, which I think they kind of do, right? So I would say there's certainly probably a need there, and something we're certainly looking at. The majority of our focus has really been on universal and getting that rolled out, which was starting this spring, which I think is a good thing. This would certainly be, I would say, a conversation that we'll continue to have.
I recognize the member for Timberlea Prospect.
Thank you, Mr. Chair. I appreciate the answer. And just over the last number of years as an MLA, we do get people that come in looking for services, and often I find they have to leave the province. So one of those services that I know someone had to leave the province for is for intensive treatment for PTS. Another one that comes to mind is for eating disorders. And actually the province did step up and help fund that particular person to go to, I think it was British Columbia, had one of the best type of services. And it just seems that there are a number of different disorders or issues related to mental illness that we have gaps in this province. So it's a general question if you want to get specific on those that I mentioned, but I would say that there could be more we're doing in some of these areas, and just your general thoughts on that.
I recognize the Minister of Addictions and Mental Health.
Yeah, I would say with eating disorders, just specifically, like that has increased significantly since the pandemic. Depression, anxiety, substance use, cannabis use, like it's increased, right? So polysubstance use in general has increased. I would say, the IWK has a pretty robust program for eating disorders specifically. We also have, I think, a strong partnership with Eating Disorders Nova Scotia as well, who are a good partner. They do a lot of virtual care and kind of, I think, work for communities across the province too that have a hard time if they're in rural Nova Scotia or something. PTSD specifically, like there is the Occupational Stress Injury Clinic, that's administered through Nova Scotia Health. That's for veterans, but it's not for, I want to say they almost have to be active duty type thing. If they're discharged, have any issues, and they run into issues with the federal government. I would say we do a lot of casework. I would say with first responders that reach out from, HRM Fire, for example, for something happened at work, and they don't feel like there's employee support that's sufficient for dealing with that specific issue. So I think it's certainly an issue. I would say certainly with first responders. We do the PSP Net program, which is specifically for first responders for traumatic and PTSD sort of issues. With municipal police forces as well. They're municipal employees, so it's a little bit of a complicated situation for healthcare services. So we do what we can, I would say, with the public system to help these people out, but there's certainly some complex issues for sure. Thank you.
I recognize the member for Timberlea Prospect.
Thank you, Mr. Chair, and I appreciate the answer. I just wanted to get it on your radar. It just seems like more and more complex issues come through the MLA offices, and often they can't get the services they need in the province. For the PTS situation, a lot of times it is funded to go to different provinces because they are part of RCMP, and some organizations do well with that. But as we're building out universal access, I think we should be thinking about trying to have a broader spectrum of services available to Nova Scotians. I did notice that the department spent $10.5 million in additional appropriations last year. Just want an explanation of where that funding has gone.
I recognize the Minister of Addictions and Mental Health.
Yes, that's all directly related to a healthcare bargaining wage settlement for healthcare staff. Yeah.
I recognize the member for Timberley Prospect.
And when the province announced the publicly funded program for private mental health care, it was $10 million. I'd like to understand how that $10 million was calculated, and does the minister believe that's enough to meet the demand for mental health services with the program announced?
I recognize the Minister of Addictions and Mental Health.
Yeah, so part of that investment, part of it's kind of foundational infrastructure to get the billing system kind of set up. The vast majority will be spent on clinical service delivery. The first phase is geared towards 50 clinicians participating, with kind of scaling up to 250 over the first several years. So it's really difficult. We know demand will probably go up, but it's, and people hear of a new program, so that might put it up too, right? So we're kind of, we'll monitor that as best we can. We do have the ability to monitor our wait lists for care quite closely too. So we'll monitor the first phase. I would certainly expect a increased investment over time, but we'll see how the first phase goes and learn from there, I think.
I recognize the member for Timberley Prospect.
Thank you, Mr. Chair. And so am I correct to say that's an estimate, and that if the services grow, that the money will be there? Like, it's not a hard cap in the budget. If the services grow, that money will be approved?
I recognize the Minister of Addictions and Mental Health.
Yeah, I would say we'll start here, and we'll certainly evaluate, as we move forward. So I'd probably just leave it at that, I think, for today. Thank you.
I recognize the member for Timberley Prospect.
Thank you, Mr. Chair. And do we have a lot of vacancies? I know we did certainly years back and we're trying to fund more, but there has been psychiatric FTE vacancies in our health zones. I wonder if the minister can let us know how that looks today, the FTE vacancies.
I recognize the Minister of Addictions and Mental Health.
Yeah, so for clinical roles with Nova Scotia Health and IWK, so the vacancy rate across disciplines has decreased from 18.5% in November 2023 to 12.6% in November 2024. I would say, just generally speaking, we've been doing pretty well with psychiatric recruitment. Psychologists have been more difficult because there's not a lot of PhD psychologists. So we're increasing capacity at Dallas program to increase that capacity. So we've added around 177 staff in Nova Scotia Health in terms of, I guess, net gains, which I think that's a good thing. Yeah, thank you.
I recognize the member for Timberley Prospect.
Thank you, Mr. Chair. And the budget highlights the $54 million in ongoing funding for initiatives that move the province toward publicly funded university mental health care. Can you break that number out, the $54 million?
I recognize the Minister of Addictions and Mental Health.
So yeah, there's quite a bit to unpack in there. So there's the I'll just give an example of some of the, I think, the more important things. So the adult community mental health and addictions step care model. There's a new addiction medicine support consult service here at the QE2, which folks that go to the emergency room, if you're on a medical floor, you can consult an addiction medicine doctor, which that's been going well. Expansion of mental health acute day hospital programs, provincial health care response to interpersonal violence. African Nova Scotia community-based child and youth services, integrated youth services, trauma-informed care. I'm just trying to pick in the bigger numbers. The managed alcohol program, the Master of Nursing program at Dalhousie University. There's training there for mental health clinicians and staff. And universal, like I said previous. Yeah, that's a few of the higher level ones. Yeah, if you want specific numbers, I'm happy to give them. Thank you.
I recognize the member for Timberley Prospect.
Yeah, I know it's a long list. Maybe we can just get that in writing sent sometime. It'd be great. There's a recommendation in the Mass Casualty Commission that recommends that there should be an establishment of a comprehensive and adequately funded model of mental health care service provision for urban and rural Nova Scotians. And this model should include first response to those in mental health crisis and continuing community support services to prevent mental health crisis from arising and recurring. So this is like a prevention thing, has to do with policing and being the first one on site. Who's leading that work? I understand there's some work within even the Premier's office on the Mass Casualty Commission, but I would think with this particular recommendation that your office is heavily engaged in what's in the budget that will ensure that Nova Scotians can get that mental health care that they need in those crisis situations.
I recognize the Minister of Addictions and Mental Health.
Yeah, so it's an important question. Yeah, in terms of the Mass Casualty Commission, I would say we've been taking a leading role, I'd say, in improving access to mental health care services, specifically around provincial grief and bereavement, which I think was identified as a key gap, I think, of that of the report. So we now have the Nova Scotia Hospice Palliative Care Association is kind of leading that work. We've hired, I think, 25 or 26 employees too with Nova Scotia Health in the northern zone, which I think is a good thing. There's also a pilot right now in Windsor with police and a Posse is a community-based organization for a non-police model for crisis response, which is the first one. So we'll certainly learn from that and try to spread that across the province. We've also done crisis intervention training with New Glasgow Police, just as an example. Led to a significant reduction in visits to the emergency department with folks just kind of using their training. So we're doing a lot, I would say, across the continuum. So there's a lot of different, I think, examples. There's been increased investments in community health boards. There was we did a pilot project with transportation in Northern Zone for folks to get to mental health appointments, as an example, which I think over 1,000 people use that pilot. So there's mobile outreach workers in the community too. So there's lots of things going on. Really trying to build trust in the community. Yeah, thank you.
I recognize the member for Timberley Prospect.
Thank you, Mr. Chair. In another report, the Desmond fatality inquiry shed some light on the issue of the challenges faced by the rural African Nova Scotian community, and I caught some of your answer from my colleague asking about equity issues in the African Nova Scotian population, but there's no mention in the business plan on the Desmond fatality inquiry's recommendations, and I'm just wondering if the minister can be specific on what the office is doing to improve and support funding and supports for rural African Nova Scotians.
I recognize the Minister of Addictions and Mental Health.
Yeah, for this specific question, we do have an advisory committee for the universal access is made up of individuals from diverse communities from across the province, including rural Nova Scotia. So we certainly are trying to work as hard as we can to build that trust and listen to their concerns. There was a new program in Antigonish actually with virtual access to psychiatric care in the emergency department that was scaled up, I think, to other parts of the province as well, which has been going well. We do finally have a full complement of psychiatrists in Eastern Zone 2, which is, I think, a really positive thing. So we certainly are continuing to work with the community and build that trust. I do think we have some great stakeholders in that area that we're trying to really work with to provide more culturally appropriate care. But that work certainly isn't just with this department; it's across many departments, I would say. But we're really focused on increasing access to the rural, healthcare for those folks. Thank you.
I recognize the member for Timberley Prospect.
Thank you, Mr. Chair. I'm sure the Minister is aware of the Canadian Alliance on Mental Illness and Mental Health, and they recently did a survey that was nationwide and gave Nova Scotia a failing grade in almost every category for mental health and substance use. There was some improvement in one category, but it went just from an F to a D in access. Now, in fairness to the Minister, the other provinces didn't do well at all either. So, but obviously, we should be striving to do better. And I'm not as familiar as the Minister would be with this organization and all the work that they do across the country, but just want to give the Minister an opportunity to comment on the findings from that, and if he expects that we will do better in their next year's report card.
I recognize the Minister of Addictions and Mental Health.
Yeah, I would say I would certainly have some concerns with the report. I think the Canadian Mental Health Association recently did a national report comparing all the provinces and territories across the country. Did have quite a few positive things to say about Nova Scotia. It wasn't perfect, to be honest, but I would say we were certainly one of the bright lights, I would say, across the country in terms of focus and investment. So yeah, we've increased the funding by 40% since 2021. It's not just a money thing; they're really complex issues, right? So you can't just throw money at this. You really have to be strategic, I think. But I think the CMHA report, I think, was pretty positive for the most part. It wasn't perfect for us either, but I mean, I think that was a good thing on a national kind of stage. Thank you.
I recognize the member for Timberley Prospect.
Thank you, Mr. Chair. And just speaking of putting money where it's needed, the Shelburne County Mental Health and Wellness Association announced last month they're shutting down because their volunteers are burnt out. An administrator with the organization said most of the volunteers spent most of their time trying to apply for grants and help continue operating instead of raising the awareness of mental health support in the community. In this budget, is there any funding to support the Shelburne County Mental Health and Wellness Association so that they can continue to do their work, or other types of associations across the province?
I recognize the Minister of Addictions and Mental Health.
Yeah, so I was down in Shelburne a couple of years ago with the MLA for the area. I met with a few different community groups and folks at the hospital. One of the big challenges they had is they did a warm line peer support service when we were also transitioning to a provincial-wide model, so everyone could access it. So that was, I know that was challenging. So I know there certainly will be investment with community groups across the province, including in that region. So I can't speak to that specific group, but yeah, I could certainly follow up with them. But there will be a significant investment in CBOs across the province. That specific example was challenging just with the transition to the provincial model. So I know that was tough for that group because I think they were doing really important work. But that's all I could really say about that. Yeah, thank you.
I recognize the member for Timberley Prospect.
Thank you, Mr. Chair. And I just want to thank the Minister for his candid and non-political remarks. It's really, really refreshing. Okay? And I'm just going to give the rest of my time to my colleague here.
I recognize the member for Cumberland North.
Thank you, Mr. Chair. And can you tell me how much time?
Absolutely. There are 33 minutes remaining.
Okay, that's great. Thank you. And my apologies. I got a little bit of a cold here. But look forward to having a good conversation and asking some questions about this very important topic. And thank you for, first of all, for your leadership in this department, a fellow registered nurse. And I know it's impossible to fix everything, but certainly we must be trying. In my area of the province, I don't know, I do feel like the need for mental health services and addiction services probably never been greater. And I don't know the underlying cause, but I suspect post-COVID, post-mass casualty, affordability crisis, I think that there's never been a greater demand. And I see that through the MLA office, but I just see it in the community as well. When I look at the budget, Minister, I don't see any significant increase in investment in mental health and addictions. I'm wondering if you did ask for an increase in your budget, and if yes, why it didn't happen.
I recognize the Minister of Addictions and Mental Health.
Yeah, I would say since 2021, we've increased the budget by about 136 million, so a pretty significant number, but close to 40%, I think. So I would say a lot of those investments, in the early days, were more foundational investments to strategically do things, right? So if you look at like the integrated youth service model, for example, that's going to be happening in the next several years. A number of these programs, the mental health acute day hospitals, they now have a yearly operational funding have been already set up. Recovery support centers, we'll have 12 of those open. So there's a lot of significant investment that was done up front. We'll see the universal health services insurance plan will be starting this spring, so there'll be an evaluation with that. And if we think it's the best, if there's ways to help Nova Scotians get services quicker, I would certainly be willing to go look for more, of an investment. So there will be an integrated youth services site in Amherst and a recovery support center also in Amherst. So that should be, I think, positive. Certainly, there's been an increase in my own MLA office too in Cape Breton especially with youth and adolescents. It seems the last 6 months or so. So it's tough. There's lots going on. The demand can feel overwhelming at times, to be honest. But we do what we can, right? So yeah.
I recognize the member for Cumberland North.
Thank you, Mr. Chair, and certainly we are very grateful for the investment with our integrated youth services. People in our community are so proud, and I have to, just give kudos to, we have so many incredible community volunteers and stakeholders that have worked towards this for years. There's a group that meet every month called Cumberland Kids, and, it's restorative justice, community services, a whole team. And I know when this funding came through, they're very grateful and really excited. I think we might be the first in the province to open next month. So looking towards the universal health services, where is that found in the budget, the money for that?
I recognize the Minister of Addictions and Mental Health.
So just to clarify, you're looking for the total number or the specific number for the HSIA, or just the total budget number?
I recognize the member from Cumberland North.
Sorry, Mr. Chair. Yes, I guess just looking at the overall budget for universal health services, the increase that we're going to see.
I recognize the Minister of Addictions and Mental Health.
Yeah. So that'd be the 54 million that's ongoing. Yeah. Yeah. Thank you.
I recognize the member for Cumberland North.
Thank you, Mr. Chair. And I'm just wondering, looking at the budget here for for the office, I'm just wondering, is it included in one of these lines, budget lines, or is it in a different part of the overall budget?
I recognize the Minister of Addictions and Mental Health.
So yeah, the majority would be in the mental health services line. Yeah, if that's helpful. Thanks.
I recognize the member for Cumberland North.
Thank you, Minister. I want to ask a couple of questions around capacity for acute care beds and for our mentally unwell patients. And I know that the capacity for hospital beds in general in the province is every day. You can go online and see the capacity numbers, and they're anywhere usually between 124 and 166%. Bottom line is we don't have enough acute care beds in our province for the number of patients that we have. I'm wondering, Minister, do you have any data on the capacity for specifically for the acute care beds for our mental health patients, like Truro and the other acute care beds?
I recognize the Minister of Addictions and Mental Health.
So yeah, so Nova Scotia Health across the province has about 366 inpatient beds. So that includes the IWK, sorry. So the Nova Scotia Mental Health Addictions, acute mental health beds is about 92% on average. I would say the four day hospitals have contributed to a significant reduction in the full capacity. So they've been actually working quite well, I would say, in reducing surge capacity of beds. In withdrawal management units, so inpatient withdrawal management units is 54%. So there's bed availability quite often in those units. So just as an example, with the day hospitals, they saved approximately 11,747 inpatient days since they launched. So the first one was in Halifax, then it was Cape Breton, then Kemptville, then Truro. So like significant impact on the whole system for a fairly small province. So yeah, so we're below 100% capacity in the bed inpatient system, which is the first time in a while, I think. Yeah. So the goal is to try to target 85% of bed occupancy for this year, which gives you that wiggle room of 15% if you need it. Thank you.
I recognize the member for Cumberland North.
Thank you, Mr. Chair. So the reason I ask the question is what I'm hearing from our psychiatrists and from our patients is often that there's no beds available, like when they have an acutely ill patient. So I am surprised to hear the number so low, because usually what I'm hearing is that there's patients are often discharged before they won't really want them to be because there's no a bed available for them. So based on my assumption, I was going to ask, was there any plan to increase the number of acute care beds? But that was because I made an assumption that there wasn't enough. So it seems like the numbers don't reflect what I'm hearing from the psychiatrists, from the healthcare team. I'm not sure if you have any comment. If the minister has any comment about that.
I recognize the Minister of Addictions and Mental Health.
Yeah, I would say we're pretty fortunate from a mental health perspective that we have a provincial system. Like we can see how many beds are, the primary care system's trying to catch up to that through electronic, infrastructure updates, I think, and those sorts of things. But I think the issue is sometimes people don't want to leave a zone to go to another zone to be admitted to it. That's an issue in my own community because there's lots of, I think, legitimate reasons for that. But if there's a bed available in the province, folks should have access to that bed, which isn't, I know, ideal at times. But I think if we do have a smaller province, so we do have, and this information I would say is fairly recent, but the kind of change in capacity. So 6 months ago, I'd say clinicians might not even know that, maybe, right? So I don't know. Thank you.
Yeah.
I recognize the member for Cumberland North.
Thank you, Mr. Chair. I'm wondering do you have the data to show, like, if there are typically empty acute care beds for mental health, is it in a certain zone consistently? And then I guess on the flip side of that, is there one zone that is typically over capacity? And the reason I'm asking that is it seems what I'm hearing in the northern zone is that Truro never has any beds available, and often people are being moved to other areas of the province and from northern zone. I'm just wondering, if that is the case, would the department look at increasing the number of acute care beds in the zone that is consistently over capacity?
I recognize the Minister of Addictions and Mental Health.
Yeah, I would say that fluctuates, like in each zone. Like in Cape Breton, we'd get patients from Truro. We would send patients to Central Zone. It kind of fluctuates depending on demand. The day hospital in Truro just opened within the last 6 months, so like I think that's still getting, I think, fully staffed up. So they're just about fully operational there. So I think that could have a cumulative impact in the northern zone too. So those effects I think are significant. So I mean we are getting closer to that 85%, which would be the goal by this time next year hopefully. So then you can kind of deal with that surge capacity as need be. Thank you.
I recognize the member for Cumberland North.
Thank you, Mr. Chair. What advice would you give me? I sometimes have constituents that cannot access therapy through the publicly funded system. And sometimes it's because there's nothing available, and other times it's because there's no therapist in our area that is able to provide the care that has been indicated for their particular condition. Leaving the patient very discouraged, I guess, because they can't get the care that they need and deserve. What advice do you have for me to pass on to that patient if they were listening right now?
I recognize the Minister of Addictions and Mental Health.
Yeah, that's a tough one, right? Tough situation sometimes. Because I think there still is a bit of a misconception that folks still think everything kind of leads to they need an inpatient hospital admission with a psychiatrist and the kind of traditional treatment, right? Which I don't think is probably a lot of the times for people. I think a big reason why we're trying to do this new program for publicly funded private therapy, basically, is to really increase capacity for folks, and especially in rural Nova Scotia, where they can do virtual care with somebody, and they could do online therapy. So that opens a new option for people. So I certainly don't have all the answers when it comes to that one, but if it's ever a crisis or something urgent, we do a really effective job, I think, in the province of getting those people help that need urgent care. We always meet those wait times. Historically, where we have a hard time is the non-urgent side of things, which I think the goal is for this to alleviate pressure with that, I think, hopefully over the coming months. Thank you.
I recognize the member for Cumberland North.
Thank you, Mr. Chair. This is a situation more where it's not an acute, it's more chronic, and the therapy is not available. Can you explain, and this may have already been explained, and I apologize if I missed it, how is the universal health services going to work? So like if a fee-for-service physician sees a patient, then they just bill MSI directly. So would it be similar that if I was seeking counseling, I would just find my own private therapist and then they would bill MSI for the psychotherapy? Is that how this is going to work sort of operationally?
I recognize the Minister of Addictions and Mental Health.
Yeah, so basically the central point of contact would be the central intake line. So they would do an assessment. So basically, in the province, the goal for non-urgent care is 28 days, which is kind of a national kind of benchmark that changes kind of based on best available research and stuff. But so if you cannot get an appointment within that benchmark, then you would be given the option of someone that's signed up to be part of this program. I think the clinical assessment would match the person with the provider versus you probably picking the provider. But I mean, if you have more of a patient choice, I would say too, right? Which is probably a good thing. there would be an expectation that the providers that are part of this program have are doing evidence-based care and have a high quality of therapeutic kind of modalities and stuff like that. So it'd be through the central intake. We can't meet those benchmarks. We would kind of offshoot to a clinician to hopefully get the person care sooner, basically. So, yeah.
I recognize the member for Cumberland North.
Thank you, Mr. Chair. And to the minister, so then that clinician would just bill MSI directly, am I understanding? And who would coordinate that the patient get booked in with the therapist?
I recognize the Minister of Addictions and Mental Health.
So yeah, there's a procurement posted now for the billing administrators that'll be closed soon, and there'll be 2 more subsequent procurements posted before the spring. So yeah, essentially be the same as a doctor, another fee-for-service clinician. So I know we've already done some work with family physicians doing autism assessments with billing codes, for example. This is different where it's in something new, right? So it's a new program. So my expectation would be the very same, similar to MSI. And we're making increased investments, I think 9 FTEs for central intake to deal with the increase in demand. And they'll kind of coordinate the logistics of appointments and all that sort of stuff. Yeah, thank you.
I recognize the member for Cumberland North.
Thank you, Mr. Chair. How much time left?
There are 17 minutes remaining.
17. Sorry, I should have my own timer on. Sorry about that.
It's all good. I recognize the member for Cumberland North.
Great, thank you. Okay, that's helpful. I was curious how that was going to work for patients. And my last question on that line is, when does the minister expect that the universal health services will be available for patients? Like, when will it be operational?
I recognize the Minister of Addictions and Mental Health.
So yeah, the goal is this spring. I'll do everything that I possibly can to make that happen. So I know it's important for people. Yeah, thank you.
I recognize the member for Cumberland North.
Thank you, Mr. Chair. All right, Minister, could I ask a couple questions around funding for the Mass Casualty Commission report and their recommendations? I have a lot of respect for Nova Scotia Hospice Association. One of my concerns is that sometimes nonprofits in this province are asked to carry a heavy load, carry a heavy burden. And recently I was at a funding announcement in Truro for Maggie's Place. It was federal government had given some money. And I was talking with Ms. Blair. She's the mayor for Christine Blair, she's the mayor for Colchester, and we had a good chat about everything. And she did share with me that, she's disappointed that there's still no sort of clinic in the Portapique area, in the area where that is a standing clinic where people can know that when and if they need clinical therapy, that it's there for them. I know there's been some mobile clinics in and out. I'd had some concerns shared with me a few months ago that it wasn't always sort of confidential because of the open space. There wasn't always like private rooms when people did go. So I share that concern with Mayor Blair, mainly because I have had some people from the Parsbro, Five Islands, Portapique area reach out to me, especially after the last tragedy on the anniversary. And I'm wondering if the minister has given any consideration for the community to use some of that funding to have an actual clinic with therapists that are there Monday to Friday, 9 to 5 hours, that people in the community would know that they are there. So if they need counseling in 6 months' time or a year's time, they're there. It's a consistent model that's there consistently in the community, not just sort of a mobile clinic that might come and go, or a nonprofit that's trying to offer grief counseling services in different communities, but actual professional therapists there in northern Nova Scotia.
I recognize the Minister of Addictions and Mental Health.
Yeah, this is an important issue, certainly for those in those communities, especially in Portapic. So we've been working on this now for quite some time, through the Mass Casualty Commission, through the federal government as well. So there's been 28 new staff with Nova Scotia Health in that zone, ranging from mental health professionals to community wellness navigators to outreach, kind of everything in the mix, I guess you would say. I think early days we went in and we set up, used some community buildings and things like that, did some therapy in the community, tried a couple different things. The community kind of feedback they gave us is they didn't really want that, to be honest. So we did some mobile therapy, and that was then we kind of worked on some community consultation for another 6 months or so, and we finally found a couple great groups that we seemed to build some trust, I think, within the community. So I know I was at the opening there of the community center in Portapic, which I know was a really important day for them. So I think the outreach continues to be ongoing. So I think if the community certainly has something they want to bring forward, we're certainly open to that conversation. But I would say there's a variety of pathways now to get care and get them connected. So it's the community. The community needs to have a say in that for sure. Thank you.
I recognize the member for Cumberland North.
Thank you, Mr. Chair, and certainly I'm sharing this information with you because I know this is something I know Mayor Blair would want you to be hearing on behalf of the community. It's what I'm hearing. I went to one of the community consultations myself, and it for the most part was Nova Scotia Health employees asking the community who in the community could provide some services to help meet the need. And I thought it was a little strange myself. And then when I did have the conversation with Mayor Blair, what she said is how I felt, and that is what the community seems to want are professional therapists, that they know the services are confidential, they're professional, and that there is an actual office that they can go and book. So, and that's not what they're seeing right now. So I'm only sharing that with you because I think that's important for the community. It's one thing to have a nonprofit offer, monthly grief sessions in a group, for groups and things like that. I'm not to take away from the importance of those things, but I think there's a need for it for a deeper level of therapy and counseling for people that's very private and that's very confidential and professional. Yeah. And I know, Minister, you mentioned the increase in number of professionals. I'm wondering, I know in Cumberland, I don't have the actual numbers, I'm not sure if you would today, but there's been quite an attrition, like quite a loss of therapists that have left the public system and moved into the private sector. And so with the additional 28 people, I'm just wondering what percentage of those would be professional therapists, like psychologists and or licensed therapists that are licensed to do counseling, professional counseling, versus maybe lay community members? That would be one part of the question. And the second one would be, if you've hired 28 and maybe 14 of them are professional, how many have you lost in the northern zone specifically?
I recognize the Minister of Addictions and Mental Health.
Yeah, I know the majority of them are clinicians, professional, but we can get the specific numbers and get them to you through Nova Scotia Health. Yeah, thank you.
I recognize the member for Cumberland North.
Thank you, Mr. Chair. I know that there's been already some questions around detox. We have one in Spring Hill. We're grateful that it's back open 7 days a week, and it had been closed for 5. I am still hearing from some family members that when their loved one has tried to access care when they were ready to get clean, there wasn't a bed available. And I'm just wondering about the capacity for our detox centers around the province, and is there any plan to increase the number of beds and capacity for our detox centers?
I recognize the Minister of Addictions and Mental Health.
Yeah, I know. Based on like the bed census, like for inpatient withdrawal management beds, I think it's around 56% occupancy rate, so it's kind of low. That being said, these are geared for more like acute detox, like 3 to 4 day type of admissions, not necessarily long-term kind of care. So I think a big part of it, people that are seeking care is that they get an accurate, a good, thorough assessment done to see what they need. Is there a need for more, community-based, longer-term treatment? Probably, right? To be honest, but from an inpatient acute withdrawal management perspective, the census is less than 60%. So I wouldn't say that means we need more hospital beds. Maybe more community-based treatment would be kind of my, I guess, assumption, not assumption, but what I've been kind of seeing, I guess. Yeah. Thank you.
I recognize the member for Cumberland North.
Thank you, Mr. Chair. So the capacity rates, it's interesting because for the detox and for acute care mental illness, they don't reflect like what I'm hearing from both professionals and from the community. So I'm surprised that they're so low. I mean, it's good, they're accurate. So maybe just the people I'm hearing from they're the ones that it's overcapacity and they're calling and not able to get in. Is there any data around those numbers? So like how often would people be denied access because of lack of bed availability for both a detox and then just regular acute care bed? It may not be available. I'm just curious.
I recognize the Minister of Addictions and Mental Health.
Yeah, I mean, if someone needed an acute psychiatric bed, there's beds available, so that they shouldn't be denied if they meet the criteria for an admission, right? Which is up to the team ultimately. But in terms of inpatient withdrawal management, that's a bit different because it's solely voluntary, right? So there's lots of beds available. Whether someone wants to take a bed that's outside of their community, that can cause some issues too, right? So understandably. So I think the surge capacity is now lower for mental health beds, which I think is a good thing. So if someone needs a bed, they should have access to the bed. Sometimes they might not agree with the assessment that they don't need a bed. That's a probably different conversation, right? But there should be a bed available for folks if they need one.
There are 5 minutes and 20 seconds remaining. I recognize the member for Cumberland North.
Thank you, Mr. Chair. I'll try to go fast. Each year when we do estimates, I always ask this question. So I'm hoping we're getting closer, and that is the establishment of a 24-hour, 7-day-a-week mobile crisis unit for Cumberland. I know it's something the professionals there have been asking for quite a few years. And I think the last year at estimates, the minister mentioned that we were close, very close to it happening. I'm just wondering if the minister might be able to provide an update.
I recognize the Minister of Addictions and Mental Health.
So yeah, there's the first pilot right now is being established in Windsor with a community-based organization, the RCMP there, has a partnership, which is really a non-police-led model, I would say, that will be 24/7, 365. So we're probably going to go down there to talk with them after the sitting finishes up before they the program launches. There's also, I think, some innovative work being done, within the ability to share information between law enforcement and healthcare providers, and we're trying to navigate the safety piece to that. So I know there's significant interest in Cape Breton, in Cumberland, different parts of the province with this. I know the Halifax service isn't 24/7 either, so that's kind of an issue too, right? So there'll be some learnings from this, so that'll be operational in the spring. So I'm looking forward to that, and hopefully we can expand it, province-wide as soon as we can. Thank you.
I recognize the member for Cumberland North.
Thank you, Mr. Chair. Kind of in line with this questioning, I had seen somewhere that there was some police training through the Department for Mental Health. Certainly what I'm hearing from law enforcement is that they don't feel that they should be the ones that are providing mental health care, that it should be the government providing mental health care when there's people that are struggling with mental illness in the community. And I think that just shows the need also for the mobile crisis unit that is staffed with trained healthcare professionals. And law enforcement are quite busy and don't feel that they are the professionals that should be providing this care. I'm just wondering, is the department sort of going to be moving towards relying more on law enforcement and training law enforcement to be providing mental health care, or is there going to be more of an effort to try to train more professionals so that law enforcement aren't being relied on for this in the communities?
I recognize the Minister of Addictions and Mental Health.
Yeah, I would say to a certain extent, the law enforcement, like, whether it's wellness checks, will always have a role to play to a certain extent. I think that the pilot in Windsor, is a non-police model, which is new. It's the first one. So that'll be helpful, I think, and we kind of increase that across the province. But I think, if law enforcement has, crisis intervention training, it's probably going to be a good thing, right? So I think we did some work with folks. I think the New Glasgow Police Service, I think they had about 72, 74 people that were diverted away from ERs because of their training. So, I wouldn't say this is something they have to do, but we would certainly be partners to try to help them, give them those extra supports. So, there's a number of different things I think you can do, but they're certainly going to have an important role to play in community-based, I think, care. Yeah. Thank you.
I recognize the member for Cumberland North.
Thank you, Mr. Chair. In my last couple minutes here, I wouldn't mind just asking the minister if there's been any movement on field legislation in relation to mental health patients. Of course, the minister may remember last year when we had many mothers come to the legislature who had lost their adult children to suicide, and I know they've been requesting the department and the minister to look at the Personal Health Information Amendment Act and look at the gaps in communication between family and when their loved ones may be suicidal and in the healthcare system. I'm just wondering if the minister's given any more consideration to working with that group of mothers and others on this important topic around privacy.
I recognize the Minister of Addictions and Mental Health with 20 seconds.
So yeah, I'll be short, but there is a roundtable scheduled next month with the mothers and with folks from IWK, Nova Scotia Health, and the deputy here. So we'll try to work through some things with them. Yeah, thank you.
Thank you. It is now time. Oh, order. Very good. Once the minister returns, it'll be the NDP's turn, and we'll start the timer at that time. NDP will have 1 hour.
Yeah. That would wrap us up about a half hour early. We might have to just sit here with each other till 7:20.
Okay. So they will have a full hour. Yeah, just to clarify, the NDP will have a full hour. I recognize the member for Cumberland North.
After the NDP are done, how much time is left before the...
30 minutes.
There will be 30 minutes left after the NDP's turn, minus the time for closing remarks. All right. It is now time for the NDP. I recognize the member for Sackville-Cobequid.
Thank you, Chair. And it's too bad you don't get air miles for the number of times you say I recognize so-and-so. Kudos to you for keeping up with that. I'm going to ask some questions. I know it's technically not your budget area, but in my view, it's intersectional. I overheard the minister's comment to a previous speaker about, it's very difficult. A comment about PhD in psychiatry grads. It's just very hard to sort of, basically produce those. So I wanted to ask a question. I don't imagine there's any funding in your particular budget area to support the development of PhD candidates. Am I wrong that falls under the budget purview of advanced education?
I recognize the Minister of Addictions and Mental Health.
Yeah, so we fund the Center for Psychological Health here at Dal with their operational funding for the program. They're one of the pilots with the service codes. So we're PhD and student psychologist work, residents work. So I would say we fund the center, but typically the seat allotments and things like that are covered through advanced education for PhD clinical psychologists. So that would be through advanced education. Thank you.
I recognize the member for Sackville-Cobequid.
Thank you, Chair. I thank the minister for that clarifying answer. So I guess my question is, when I look at the budget for advanced education, noting that your most of the seat count and the funding for sort of the student portion of that is covered under advanced education. When I look at the budget, there is a line for research under advanced education, and that budget line is effectively static this year. And I'm just looking at my notes. Yeah, so on just for your reference, on page 3.5 of the budget document, research and innovation funding, the 2024-2025 estimate is 7,446, and then the 2025-2026 estimate is identical. And I asked that question on purpose because I happen to know, full disclosure, I'm married to the new Sun Life Chair in mental health and addictions, youth mental health at Dalhousie. And I'm aware part of her role is to basically take on and mentor graduate and doctoral students, many of whom would go on to the kind of positions that you're talking about that are needed in our system. So I'm wondering what the minister can tell me about input to, I guess, earmark additional funding for PhD candidates through research. And what I mean by that is it's not uncommon for highly sought after graduate and post-grad students to be recruited and retained and funded in their study through research grants or through research money afforded to faculty. So there's a relationship between, I know the line is not direct, but nonetheless it has a significant impact on how many candidates can afford to access that training and be funded to complete it before they carry on sort of the clinical portion of their training. What kind of conversations happen interdepartmentally between addictions and mental health and advanced education so that there is sort of a pot of money in that broader research piece that's available to faculty with a particular purview who are actually qualified to take on research candidates that can then turn around and become candidates in the clinical sense?
I recognize the Minister of Addictions and Mental Health.
Yeah, that's a good question. So I know we did add some financial support for increased residency programs for PhD clinical psychologists with the Center for Psychological Health. And there's been some conversations now with the student psychologist representative at Dell for increased funding with them. The Bachelor of Social Work at CBU, we've had collaborative conversations with advanced education for that program. So just as an example, they're really focused on rural and Indigenous kind of mental health and underserved communities. We've had, the program at Dow for the Masters of Nursing for Advanced Practice for Mental Health is another, there's kind of collaborative conversations are ongoing. So yeah, we certainly know there's a demand for that for sure. I would say part of the other conversations too is that sometimes if we want to go a little bit faster, universities have some concerns with being able to do it themselves, because we've actually had pushback where they said they can't do things as fast as we like sometimes. So and there'll be a new research stream at Research Nova Scotia dedicated for innovation in mental health, which I think is which is a big thing. I know there was recently a little bit off topic, but there was a professor at CBU that just got over $12 million for rural Nova Scotia and seniors health more so across the province. That's a multi-year. That's a big investment. So some good things happening, but there certainly we need to increase our capacity looking forward, I think. So those certainly ongoing with advanced education. Yeah, thank you.
I recognize the member for Sackville-Cobequid.
Thank you, Chair. Just to follow up this vein of discussion, I guess I'm recognizing it may not be in this year's budget, but I'd encourage the minister to pursue this line of questioning with his colleague in advanced education. Research, because of my adjacency to some of the things that we're talking about through my relationship, I understand that at times money doesn't cross all these lines in the neatest way. And because it kind of comes from a certain pot, there's limitations on how it can be devoted. So promoting research in mental health doesn't necessarily mean that we're funding students to pursue this higher order learning necessary to become practicing clinicians. And so I urge the minister to have the conversation about where does that money best need to sit in a budget so that it can translate into funding. It would be a research pot of money, but it also has the byproduct of funding students to pursue education that's very expensive. These candidates take on a lot of burden financially to pursue this training. And then a lot of them have to leave province because, they've got a big debt to service. So if there's a way that we can sort of marry these two things because of this interrelated aspect, I think it's something for future budgets that perhaps could be considered and, piloted and evaluated, for a short window of time before it's normalized. Thank you for your thoughts and your response on that. I have some questions about the Universal Mental Health Program announced and kind of where that's situated in the budget. So just for my own reference, am I correct that the money for the Universal Mental Health Program, and by that I mean sort of the publicly funded access to what would normally be private care, that's the envelope I'm talking about. Am I correct to look for that in the mental health services line on page 2120? Okay. So I have some questions about, obviously there's a $5 million increase to that line in terms of projection. So how much of that $5 million increase is going to the creation and operation of universal mental health? Obviously, this has been a program the government has made a big splash about in the media. So I'm just curious how much of that additional $5 million is going to go to this particular launch and project.
I recognize the Minister of Addictions and Mental Health.
So yeah, there's a bit of an offset there financially. So for the HSIA pilot, I guess, or the rollout in the spring will be $10 million. There were some wage increases, which was $5.8 million, and some reductions in temporary funding of $6.5 million. So it's a long-winded way of saying it's $10 million for that first phase. Thank you.
I recognize the member for Sackville-Cobequid.
Thank the minister for that answer. So just want to sit with that 10 million for a couple minutes. How much of that 10 million is earmarked for the development of sort of the central booking and assessment and then sort of clinician assignment process? Understanding that's sort of an important backbone of the program, how much of the money we're spending this year goes into the machine, so to speak, that will connect people in need to the care through this program?
I recognize the Minister of Addictions and Mental Health.
So we already have a central intake system. We've had it for a number of years. We're one of the only provinces in the country that actually has a province-wide central intake system. So we're going to enhance the system through, there's going to be an increased 9 FTEs. There's also going to be some infrastructure improvements, I think, some technological improvements. I'd love to see some ability to be able to utilize some more technology and kind of making things easier to access for folks. So yeah, you're right in the sense where it'll be the central point of intake for mental health in Nova Scotia, right, basically. So this will be the mechanism too where folks can have perhaps some choice with a clinician, and also the ability to be referred back to some community-based resources too if need be. We know we have a significant number of phone calls. I know there were 17,000 intakes last year as an example. There was, I think, over 25,000 calls, just in terms of volume. So I suspect that will go up probably quite a bit. So we'll have some increased investments for that, but the vast majority of this money will be for clinical care, would be my expectation. Thank you.
I recognize the member for Sackville-Cobequid.
So in year one, understanding the backbone doesn't need to be built, you're going to be able to, in effect, piggyback on an existing infrastructure. The additional inputs to accommodate this launch is 9 FTEs, and you mentioned some technology along with that. How much of that 10 million is sort of absorbed by those 9 additional FTEs and the tech that you're talking about?
I recognize the Minister of Addictions and Mental Health.
Yeah, so the increase in FTEs for intake that's through a separate pot of money, basically, and the improvements with that will be through that. There is a procurement posted now for the billing administrator, so the clinicians will have a mechanism to bill the province for the service. There's also we have to invest in some technology for measurement-based care, so we can see how people are doing and really keep people accountable, right, if it's publicly funded. So that's kind of part of that process, but that procurement's posted now. So there'll be, I guess, more to say in the specific amounts because it isn't closed yet, but the expectation that the vast majority would be for clinical service delivery.
I recognize the member for Sackville-Cobequid.
Yeah, I'm not asking the question as a gotcha. I understand when you launch a new program, if you're going to buy a new house, you have to fill it with furniture. There are some startup costs that you're not going to pay year over year once you've moved in. So this is not a gotcha question. And I'm simply trying to wrap my head around how much upfront cost as a one-time get started is going to come out of that $10 million. So it doesn't sound like you necessarily have a number attached to those get started costs.
I recognize the Minister of Addictions and Mental Health.
Well, the procurement is posted now, right? So I can't comment on we don't know, to be honest. So we'll see how that goes, and we'll have more to say, I think, as they kind of move forward. Thank you.
I recognize the member for Sackville-Cobequid.
more on universal mental health. I've been approached by a number of clinicians and practitioners in private practice and mental health, both in constituency and elsewhere in Nova Scotia. Obviously this program potentially is of interest to them. So this $10 million, I want to kind of conceptualize this in a slightly different way. The number that's been floated in terms of how much an hour of a clinician's time is going to be worth, billably speaking, is, am I wrong that that number is $160 an hour?
I recognize the Minister of Addictions and Mental Health.
Yeah, I would say that this will be part of the procurement, the last procurement. But just as an example, the pilot that we did with the psychologist was basically comparable to market rate. Just generally speaking, as part of this program, there'll be registered counseling therapists, MSWs, and psychologists, like who even themselves can get different rates, right, depending on the compensation mechanism. So there'll be more to say, I would say, in the coming months, but I think it'd be fair, very fair compensation based on the pilots that we've done. Thank you.
I recognize the member for Sackville-Cobequid.
So understanding some variance in the rate, again, I'm just asking the question if 160 is a reasonable ballpark per billable hour.
I recognize the Minister of Addictions and Mental Health.
So there often in practice there's some variance between, for example, a registered counseling therapist and a PhD level psychologist. So the compensation conversations will be part of that procurement, but it won't be the same for each clinical discipline, right? So with the psychologist, for example, for the ASD and ADHD pilots, there was about 200 assessments completed at the market rate, essentially. So thank you.
I recognize the member for Sackville-Cobequid.
So those are completed and not a matter of procurement. So what was the market rate for those assessments?
I recognize the Minister of Addictions and Mental Health.
So for that specific pilot, it was $210 an hour for the psychologist, and I believe there was estimations. There's ballpark estimations for ASD and ADH diagnostic assessments that in the public system that were used as comparatives to that. So it was essentially the same comparatives. Thank you.
I recognize the member for Sackville-Cobequid.
Just last question on sort of a ballpark rate. Would you say that 210 an hour would be on the high end of hourly rate in terms of billables?
I recognize the Minister of Addictions and Mental Health.
Yeah, I would say, to give a specific number today, I'd be hesitant to do that. Like, for example, an autism, diagnostic test can vary between, then there could be like a therapeutic intervention that's a different rate too, right? We will have a very specific list of billing codes for specific evidence-based services with attached compensation numbers. So we'll be very transparent with that and certainly have collective conversations. But the psychologist would be at the top of the spectrum based on their education and qualifications, right? So, so we'll kind of look at that as it comes. Thank you.
I recognize the member for Sackville-Cobequid.
Okay. So this program in particular is going to be people get help from somebody who bill MSI an hourly rate of some sort. How much of this 10 million, how many hours of treatment does this program aim to deliver in the forecasted budget year?
I recognize the Minister of Addictions and Mental Health.
Yeah, so the first phase, the goal is to start with 50 clinicians. So I would say typically for most like evidence-based treatments, usually it's 8 to 10 sessions typically is kind of the benchmark, I would say. So probably start somewhere in that range based on the feedback we get as the procurements kind of come down. The 50 clinicians won't necessarily have to be full-time FTEs. There could be some part-times in there. Like to the 20 FTE equivalents would be the goal, and scale up to 250 over the first several years. So yeah, that's the goal. I think we've had significant outreach actually since the announcement already, so which I think is positive. So we're looking forward to that, and yeah, that would be just a billable service to the government. Thank you.
I recognize the member for Sackville-Cobequid.
Not all workers, when we talk about FTEs, have the same number of hours per work week. How many hours would an FTE work per week in this particular context?
I recognize the Minister of Addictions and Mental Health.
Yeah, I think it's around 35 hours weekly, but I'll confirm with that. I can follow up. Yeah, thank you.
I recognize the member for Sackville-Cobequid.
I apologize is the wrong word, but I hope you'll pardon sort of the granular level of my thinking. But so an FTE, how many weeks a year is this FTE working? So if they work 35 hours a week, how many weeks out of the 52 are they delivering services in your estimation?
I recognize the Minister of Addictions and Mental Health.
Yeah, so that's a very specific question, so I could certainly take that away. So the ballpark would be about 10 sessions per person. Yeah, so I think that's where I would leave that. I can follow up with a very specific question there. Thank you.
I recognize the member for Sackville-Cobequid.
Okay, so 50 clinicians delivering 10 hours of therapy in the first year at $200 an hour or slightly more is only $100,000. So the scope of this program, we've got 10 million. I'm not arguing the number of starting with 50 and scaling up from there, but I'm trying to figure out where this 10 million is going to go and how it's going to be spent. So if we have 50 people delivering 10 hours of care, and that's the goal for each one, that's only going to spend $100,000 of that money. And that's 50 times 10 is 500 hours of therapy. So I understand that these clinicians are delivering, in my neophyte understanding of sort of the tiers of care and intervention, sort of level 2.5, tier 2.5 interventions. So ostensibly, the benefit of this program is that suddenly there are 500 tier 2.5 hours that are off the plate of the public system. People that would be seeking this care in publicly funded systems are going to get it through private practitioners. How are those hours going to be sort of repurposed, and where are they going to be redirected within the public system to meet needs and bottlenecks that exist?
I recognize the Minister of Addictions and Mental Health.
Yeah, so I think the goal for this program is to really focus on the non-urgent wait times and access to care in the province for anxiety and depression. So I think, as we kind of talked about before, like one individual person seeing one individual clinician could require between 8 to 10 sessions themselves at that rate per hour, right? So that's just one person, right? So if you extrapolate that for more people across the province with 50 clinicians, I think the number would be higher, right? So but it's very much a test and try and improve, right, and evaluation. So the goal is to increase access to care, and I think it's certainly, hopefully, I think can do that. Thank you.
I recognize the member for Sackville-Cobequid.
Thank you, Chair. My other question is how much of this budget has wrapped its head around the need for a communication plan to private sector practitioners who may want to offer their services. I know there's going to be an application process to determine who the 50 are going to be. It's unclear whether or not the people that are sort of approved to deliver care through this program are going to be able to sort of close their individual practices and make this their full-time gig, so to speak. I don't think that's the intention of the program, that they're going to cease seeing clients privately. But one of the challenges of this that's been made clear to me is that this is a group of people with no central representative body. There's no organization or no elected representative on their behalf through which to communicate and convey to the community practicing in the private sector, you know, what's happening with the program, how it's going to expand. And I guess one of my concerns there is that also structurally makes it very difficult to collect feedback from this community that stands to aid the efficiency and effectiveness of this pilot. I understand with any pilot there are going to be kinks and clunks and lumps that come along with that, and that's not because anybody means anything untoward. It just, that's the nature of new things. You know, you learn as much by what you're not getting right as by what you hit out of the park, and that's okay. So to that, you know, to put a fine point on the question, how much of this money is going to a communications plan that's actually going to be a direct line to these folks that don't have a central representative body, so that communication aids the development, you know, the success of the pilot and its future expansion?
I recognize the Minister of Addictions and Mental Health.
Yeah, so that's a good question. Like, we'll certainly have a comprehensive communication plan for Nova Scotians, but I would say since the announcement, we've had a significant outreach from a variety of clinicians across the province. That being said, there'll be a specific process through procurement of who can qualify and what that process looks like. I would say if you know, talking to psychologists and social workers, they have pretty, I think, well-established, you know, professional bodies, you know, regulatory bodies for sure that are well-established. Registered counseling therapists are a bit newer in the sense of the self-regulation piece. But they're also, I think, a tremendous asset that could be an untapped resource, I think, for the program. So we'll work through that. I've done a number of town halls myself, and I continue to talk to people, and I'll continue to do that as we kind of move forward. But it'll be critical to get their feedback. Thank you.
I recognize the member from Sackville-Cobequid.
Thank you, Chair, and welcome. I have been speaking with folks that are MSWs, psychologists, and you know, PhD holders. And you know, I do understand that they have licensing bodies, but I also understand in a very pointed way from their comments that those licensing bodies are not well suited to be a two-way input-output conveyor of feedback. That is not their role. So I understand this government's, you know, your mojo is more, faster, cheaper. But I guess I urge the minister to consider that this is a group of people that doesn't have the mechanisms. It would be very easy to assume that these bodies are going to be able to pivot on short notice and provide a function and a capacity that they are not used to providing. And that may inhibit the success of this pilot. So, I think along with the how are people going to get paid, how are bookings going to be assigned. I know those are all big questions of folks in private practice who may want to or evaluating whether or not they want to apply to deliver care through this new pilot. But I would also encourage you to weigh the need for perhaps building a communications apparatus, because one does not currently exist, and it would be risky to assume that their licensing bodies can just step in and fill this gap. I think it's been made abundantly clear to me by folks in this community that is a risky assumption to make in terms of proceeding. So I just share that feedback with you for your deliberation as you action this pilot, because there is an opportunity for this to have a positive impact for Nova Scotians and mental health, and we'll want to do what we can. I want to offer constructive feedback that benefits the success of the program through that lens. I have one final question for the Minister Chair. We've just asked a bunch, and they're not related to universal mental health, but I'm aware that one of the, I don't want to call it an inefficiency, because that suggests that people are letting things drop, and that's not what's happening here. So I think one of the losses that occurs regularly in terms of the delivery of mental health is the number of appointments at a range of, we just talked about, level 2.5 interventions for mood disorders and anxiety. Understand some interventions are lower tier than that and some are higher. But nonetheless, to access these resources, and invariably there are appointments with providers in the public system. So you call an office, you get an appointment, you're supposed to attend at this hour on this day to see the person that's going to deliver that level of care to you based on your need. So that's a concept, people watching at home will wrap their heads around very easily. What I'm aware of is that there is a substantial, absentee rate or no-show rate for appointments. And that's no fault of the clinicians or the practitioners delivering the care. But I guess one of my concerns is, and I don't know where we would see this in the budget, and perhaps the minister and his team have turned their minds to addressing this issue, but where in the budget are there resources designed to remedy sort of this rate? I've heard numbers as high as 35% of appointments go unfulfilled because people don't show up, or, I was supposed to be here, sorry, I can't make it, the drive is too long. That's a staggering number of hours annually where care is not provided. And it's not because anybody doesn't care or anyone's done anything wrong, but people are not showing up to appointments, and that's care that could be provided to somebody else. Can the minister talk about where in the budget, what resources are being brought to bear to bring that loss of care because of no-shows? What's the goal? I understand you can never completely eliminate no-shows. That happens. What's the target goal for no-shows so that more people get seen more often at the right level of care within the system?
I recognize the Minister of Addictions and Mental Health.
Yeah, it's a significant issue. Certainly the no-show rate, I would say, of mental health appointments and the impact it has on the efficiency, right, of human resource and capacity. So we could have very accurate, I would say, surveillance on the number of no-shows in each zone, each community outpatient clinic, inpatient clinic, et cetera. I know the IWK does as well. There's been a lot of work to be more flexible in structuring administration time. So there's an ability to swap appointments very quickly if there's a no-show. I know something else we've been looking at too is the ability to text as a reminder. It's been very successful in the UK, for example. So we're kind of looking at that right now. And something we did, I think, in Northern Zone that was very helpful was a transportation pilot. Like people wouldn't go to the appointments because they didn't have or couldn't afford transportation. So I think in the course of a year or less, there's 1,000 people that use this pilot in rural Nova Scotia. So just trying to think differently. I think it's a significant issue, and you can lose a lot of productivity, I would say, in the system. So we're trying to do everything we can to work on it, I think. And I think that work is certainly ongoing. Thank you.
I recognize the MLA for Sackville-Cobequid.
Thank you, Chair. I would just urge the minister, of all the things that we can do, you can spend a lot of money with the best of intent and sort of not achieve the kind of impact that you want to when you sit in the chair that the minister does. I respect that. But I would encourage the minister to perhaps sort of redouble efforts in this area. This is money already spent that perhaps doesn't yield the kind of impact that it has the potential to yield. It doesn't require necessarily new money, but I think some resources to get a hold of this, and so that more people, are seen than are currently being seen. That's a way to make more of the money that's already being spent, and I think that's good value for Nova Scotians. I certainly I want to iterate that the people delivering care, I know they work their best every day to provide care, and this is through no fault of their own. But and I know that they want to make an impact, but it's hard to make an impact on an empty chair when you're delivering care in this kind of model, and this issue is so persistent. So I think it's worth kind of flagging that. I don't think it requires necessarily a budget line, but just want to encourage the minister. Perhaps take that under advisement as a goal. If there are no targets set about, and I apologize, I threw the word no-show rate out there. There's probably a metric for it. If I've used the wrong one, I apologize. I don't mean it in any mean-spirited way, but maybe it's worth having a conversation within the department about what is the no-show rate that we can live with, and how do we get it down to that level. And talking to frontline folks is a great way to figure that out. Glad to hear about the transportation pilot. I would argue, knowing my community in Sackville-Cobequid, it would be easy to assume that access to transportation as a factor in that no-show rate would be, prominent or sort of mostly a thing in rural Nova Scotia. I got lots of people in Sackville-Cobequid that would benefit from access to a similar program. Would make a marked difference in Halifax Metro, where I think a lot of people think all the services are there, it's easy to get to. Lots of people face those barriers in parts of the province we may not automatically assume would be impacted. So I want to say thank you to the minister for his thoughtful comments. Thanks to staff as well, and thank you, Chair, for the opportunity.
I recognize the MLA for Halifax Sable Island.
Thank you. I'm wondering what the net increase or decrease has been in the number of psychiatrists in this year to date in Nova Scotia.
I recognize the Minister of Addictions and Mental Health.
Yeah, so I'll start with adult psychiatry. So for Eastern, there's 15.5. That's a full complement. Northern has 10.6. Western has 15. So for child and adolescent, there is 2.5 in Eastern with 1 vacancy, 3.4 in Northern, 2 in Western with 1 vacancy, and there's 2 vacancies in Central.
2 in total.
Okay, so yeah, so sorry, that's 2 vacancies in total. So, so for a total of for adults, it's 110
In place.
in
6,
place.
6.
Yeah. Okay, thank you.
I recognize the MLA for Halifax, Sydney, Citadel. Sorry, I was doing Sydney Marmarket over there. Apologize. I recognize the MLA for Halifax, Citadel, Sable Island.
And so that's very helpful. It doesn't sound like there's a huge amount of vacancies, but I'm wondering, my question was actually like, what's the net increase or decrease this year? So, and I would also extend that to psychologists.
I recognize the Minister of Addictions and Mental Health.
Yeah, I think we would have the FTE vacancies by zone. We can follow up to get the specific net increases, like for year over year, if that's what you're requesting. But I would say, generally speaking, psychiatry has been pretty positive. So there's certainly some gaps for psychologists that we're actively working to fill, which isn't a new issue, but something we're certainly trying to improve. Thank you.
I recognize a member from Halifax, Citadel, Sable Island.
Thank you. And yes, if the minister could follow up with that information for psychiatrists and psychologists, that would be really helpful. So sort of switching to the other end of the tiers in terms of treatment and that sort of thing. What is the non-voluntary inpatient admission rates in various zones to inpatient?
I recognize the Minister of Addictions and Mental Health.
So you're looking for the involuntary admissions for inpatient acute mental health beds by zones? Okay, just 1 second.
I recognize the member from Halifax, Citadel, Sable Island.
Yes, so amongst inpatient beds, what's the non-voluntary admission rate by zone?
I recognize the Minister of Addictions and Mental Health.
So for 24-25 year to date, for Central Zone, it's been 173. For Eastern, it's 139. For Northern, it's 46. For Western, it is 95. So I think that's a total of 453. Yes, yeah, thank you.
I recognize the MLA for Halifax, Citadel, Sable Island.
And what I was interested in was what that represents in terms of proportion, in terms of inpatient admittances. So are you able to provide that?
I recognize the Minister of Addictions and Mental Health.
Yeah, so for Central Zone for 24-25 year to date, so 78% of those 173 would be involuntary. For Eastern Zone, 46% of the 139. For Northern Zone, 55% of the 46. And for Western Zone, 46% of the 95. So I think the average is somewhere around 56%. But in Central Zone, it's closer to 80%, it looks like. So it's looks like a bit of an outlier, I guess you would say. But yeah, thank you.
I recognize the MLA for Halifax Citadel Stable Island. Sorry.
And I guess I'm wondering, you know, with the creation of the day hospitals and that sort of thing, so I mean, that might be one reason why Central Zone looks different, right? So that folks who would otherwise need or resort to inpatient care or have the access to the day hospitals. And so is there a goal, is there a target in terms of with inpatient admittance in the province to have more of them be involuntary and have the day hospitals pick up more of the voluntary admittances?
Recognize the Minister of Addictions and Mental Health.
Yeah, I would say the short answer is yes, right? So I think you look at, you know, it's been the first time in quite some time across the province where we've seen it, you know, the inpatient bed capacity for mental health beds is kind of creeping down towards the 95% mark. I know for years it was like 100+% for quite some time. That's what we'll try to get that down to around 85% would be the goal of inpatient bed capacity. And I think really, and patients really do like the day hospitals based on the feedback we've been getting. Yeah, so I think if you think of that and you think of the inpatient acute care settings are really meant for the sickest people, right? And so, and especially if they're involuntary. So yeah, we also monitor closely the number of readmissions as well and those sorts of things. So I know the newest day hospital in Truro hasn't been open for that long. So I suspect that could also have a pretty positive impact on the total system, hopefully. So, but we'll see. Thank you.
I recognize the member for Halifax Citadel Stable Island.
And actually, speaking of readmission, so I was going to ask, what's the hospital readmission rate within 30 days after discharge from either the day hospital or the inpatient program?
I recognize the Minister of Addictions and Mental Health.
We do have that. We just don't have it here, so we can follow up to get that to the member if that's okay. Thank you.
I recognize the MLA for Halifax Citadel Stable Island.
What do we know about the suicide rate in Nova Scotia this year to date and the numbers of suicides?
I recognize the Minister of Addictions and Mental Health.
So yeah, it's certainly a very important issue. It can be a very tragic, situation for any families that are impacted by suicide. It's very, complex and an issue. Certainly something we're working hard on in the department. So most of the data we get is from the medical examiner's office in Nova Scotia. Indicates that there were 155 from January 24 to December 2024. So this is a bit higher than historic data. So these numbers can change over time based on different information that kind of comes in. Highest level of risk in the 20 to 44 and 60 plus year for both males and females. The mortality rate among individuals aged below 20 years is projected to be the lowest annual rate in quite some time. So I'd say just in general, the suicide risk assessment tools for Nova Scotia Health, IWK, have been updated as well to include safety and consistency in planning during the intake process. So it's a really important part of the intake process. We hosted FPT meetings here a couple weeks ago with the federal and provincial territory ministers. The National Suicide Prevention and Risk Reduction Framework was launched in 2024, I believe. So it's a significant issue right across the country for sure, especially up north. It's a real issue there. So we'll continue to work with this. This is a 3-year plan with really, shared action across the country to really try to reduce this issue as best we can, not just with government, but also with non-government groups as well. So yeah, we continue to provide funding and policy and programs to support Nova Scotians as the best we can. So there was a campaign in September of 2023 to really focus on men's mental health, those at highest risk for suicide. There's also a number of programs.
Minister, I'm going to recognize the MLA for Halifax, Sidney, Sable Island with 849. Okay.
Thank you. Apologies, I just wanted to hop in a bit more. So I'm wondering, I mean, you've talked about suicide is complex. Suicide is also an area where, access to evidence-based practices is really important. So, and I was actually involved in a research project before being elected that was part of the framework that's been developed nationally. So I spent a year reading about evidence-based practices for young people and like 1,500 articles. So I do have a sense of kind of the depth of research that's out there. At the same time, the complexity of the issue. So what's happening specifically in Nova Scotia around this? Because, I know I have tabled in the previous session a bill to create a suicide reduction strategy for Nova Scotia. I know at that time the Deputy Minister said, well, it's integrated, we do it, and that sort of thing. But now, are we getting additional funding, and what's going to be happening in Nova Scotia specifically?
I recognize the Minister of Addictions and Mental Health.
Yeah, it's an important question. So in terms of the federal framework and strategy, we have, I would say, very frequent ongoing dialogue, especially with the Public Health Agency of Canada. So that's kind of one specific piece. I think our focus on universal access is really to get people help before they get to the point where they're very sick or in a crisis situation. We have had are part of the national launch of the 3-digit 988 crisis service as well. And certainly there continues to be, evidence-based treatment and evidence-based crisis supports throughout the healthcare system. Certainly acknowledge that it's definitely a complex issue. We'll certainly continue to do everything that we can to reduce this issue.
I recognize the MLA for Halifax, Sidney, Sable Island.
So is there funding associated with the federal framework that Nova Scotia is receiving?
Sorry. I recognize the Minister of Addictions and Mental Health.
There's no funding right now that I'm aware of, but there will certainly conversations, I would say, are ongoing, and I would certainly advocate for that. Thank you.
I recognize the MLA for Halifax, Sidney, Sable Island.
Sorry. What else did I want to talk about with suicide? And I appreciate, the investments in universal mental health and that sort of thing. But like you said, it seems to me like we have, if I could draw a continuum, but I can't because that would be a prof. But if I could draw a picture of where, a lot of the services are landing, the universal mental health pilot is really at the sort of tier 2. And you're right, like but that the idea behind treating mental health early and promptly and having early intervention is that, of course, it can actually prevent it from becoming chronic and from accelerating. But the link between someone with sort of low or moderate level anxiety and depression to suicidality is actually not clear in sort of the evidence and the research. So I guess, you know, for Nova Scotia, like what would it take to have a suicide prevention strategy? Like, why have we not chosen to really think about specifically the types of interventions that are needed around that?
Recognize the Minister of Mental Health, or Addictions and Mental Health.
Yeah, I would say we're very active participants with the federal government and the other provinces and territories with the new framework. We'll certainly continue to do that work. I think we do offer, you know, if you look at like the peer support provincial phone line, to recovery support centers, to day hospitals, to acute mental inpatient beds, 3-digit crisis line, I mean, integrated youth services, this is all geared towards, you know, timely access to care, especially for youth, and this will open up options for care that are really, you know, community based and very accessible to folks. We also have a significant relationship too with Kids Help Phone and the crisis line at Escazone, so we're doing a lot. I think in the crisis space, we can certainly always do more. We'll continue with that work. Thank you.
I recognize the MLA for Halifax, Sydney, Sable Island.
You know,
With 3 minutes.
okay, thank you. You know, and certainly I acknowledge the ways in which, you know, the provinces partner with Kids Help Phone and other, you know, really important services. But I don't get a sense that we understand well how those all work together, and whether, in fact, they're having a preventative effect on reducing suicide in the province. So, you know, I know that you said that this past year, we seem to be trending higher than historical, and I don't know if you've, you know, looked at that in terms of population growth and all that sort of stuff. But, you know, I guess I would say if we're trending higher, and, you know, and I think we recently reached in 2022, but I can be corrected, the highest rate of suicide that we've ever seen in Nova Scotia. So the trend isn't positive. And so I guess I would say, like, do we really know what we're doing and understand what we're doing in a really specific way to prevent suicide in Nova Scotia?
I recognize the Minister of Addictions and Mental Health.
Yeah, that's an important point. This is a, you know, really important issue. So I think that's really part of the work that we've been doing, that we continue to do, especially with the system integration and providing universal supports to people, and, you know, strong public health surveillance as well, I think is part of that. So that's part of the work that's ongoing. We're certainly committed to doing the very best we can to do this work. Thank you.
I recognize the member for Halifax, Sydney, Sable Island.
How much time? 5 minutes.
Oh, I'm sorry.
Okay, that's
sorry.
fine. I think I have a minute left. So, so just to say, you know, I really appreciate this conversation, and, you know, I, you know, would like to be able to be supportive as the official opposition in the implementation of mental health programs across Nova Scotia. So, you know, I appreciate other opportunities to connect.
I recognize the Minister of Addictions and Mental Health.
Thank you.
So we have 29 minutes and 44 seconds left. Where there's no Liberals here, I guess I asked the NDP, do you wish to ask more, or do you want to cede your time to independent member?
Yeah, independent members.
Oh, I'm sorry.
I would
Yeah, I know, but I have to ask her.
I would like to
Yep.
cede
Just one second. I just want to be clear. The rules say that I ask the NDP if they want to cede the time, okay? Ask the MLA for Halifax Digital Sable Island.
Thank you very much. And yes, we would like to see the remainder of our time to the independent member.
I thank you. So I asked, asked the member from Cumberland North if she has any questions. MLA for Cumberland North if she has any questions.
Thank you, Mr. Chair. Yes, so I'll just follow up on some of my questions from before. Minister, it's a lot of times I'll have conversations with people. In fact, I just had one with someone who has a family member that is mentally unwell, and they're having trouble accessing help. And so I was just trying to counsel them through, how they can get some help. But one of the things that I've found with the people in my area, and this is the same with the person that I just spoke with, is that they don't always find the centralized phone number and that approach to be effective or to be the most helpful. In fact, I've even helped constituents to call through and have found it to be quite cumbersome. So if you're already kind of having a mental health crisis and you're trying to navigate the press 4 and press 3 and trying to figure that out, it can be quite stressful. Has there been any consideration to just going back to having a local phone number where somebody could call and make an appointment and not have to go through that whole voice messaging system, and people just call a number and somebody would answer the phone like a human being would be on the other end?
I recognize the Minister of Addictions and Mental Health.
Yes, that can be a problem for sure, sometimes for people. So part of the enhancements to the intake system that we're kind of looking at now will actually have some people working on intake, but in those communities, basically. They'll still be part of the central intake system, but they could be someone, locally would be the goal. I think if anyone's in a crisis, they should always use the 3-digit crisis line, right? It's always a good resource for people, the 988. So I think that's probably part of the conversation, but I think there's also a lot of services that are underutilized, right? If you're looking at access wellness, or depending on the individual, how they feel about mental health, tranquility or virtual care, these sorts of things, right? So, but for a true crisis, I would say 988, but I would say there will be some improvements to the intake system so they can actually talk to a physical person. So I know when people want to reach out for help, that can be a barrier, right, to seeking care. Thank you.
I recognize the MLA for Cumberland North.
Thank you, Mr. Chair. Thank you, Minister. And a lot of people aren't aware still of that 3-digit number. Yeah. Or even of some of the other services that you mentioned. So like in Amherst, for example, there's an Amherst phone number, but when you call that number, it doesn't take you to the Amherst clinic. It takes you to, sort of redirects to the centralized intake. So people are calling that number thinking that they're calling the local clinic, but it doesn't actually go to that. But I just wanted to share that with you, some of the feedback that I get. And certainly I've seen this also with other departments. We've seen it in transportation. There's the centralized number. So people in Cumberland County get pretty annoyed that they're calling Cape Breton when their roads are not salted or plowed 10 o'clock at night on a Saturday night. And they're like, why am I calling a Cape Breton number? They just want to call somebody, at the local office, right? And like it used to be 50 years ago. But it's similar in mental health as well, in just being able to access a person to be able to talk to. And, yeah. So another question I have is 144 Nova Scotians died by suicide last year. Sobering. Sorry, just one sec. For every one person who dies, 10 more people are seriously impacted. Sorry, I didn't expect to do that. Some suffering serious health issues as a result of the trauma they experienced. When will Nova Scotians see a suicide prevention plan from the department?
Excuse me. I recognize the Minister of Addictions and Mental Health.
Yeah, it's a tough issue to discuss, right? It's a tragic loss, right, for families across the province. We've had multiple conversations with the federal government and the Public Health Agency of Canada, and this past, it was in 2024, they launched the National Suicide Prevention and Risk Reduction framework. We're certainly part of that framework and continue to be active partners. They were just here 2 weeks ago for FPT, so it was certainly something that we talked about. The three-digit crisis, I think, is a good thing. We do have significant enhancements in supports for virtual, care for psychiatry, for community outreach. So it's certainly a significant issue. Our goal is to really offer, a suite of services across the continuum of care to really try to get people help before they get to that point. But we certainly know that, it's certainly not perfect. We do have to have strong, I think, public health surveillance to really keep a good eye on the numbers and do everything that we can, to try to combat that, to the best of our ability. Thank you.
I recognize the MLA for Cumberland North.
Thank you, Mr. Chair. So, so the question was more like, is there going to be, or is there any work on an actual suicide prevention plan, like a suicide prevention strategy? I know other provinces, I believe, do have things like that in place. So just wondering if is that something that the department is working on? And just a follow-up with that, what do the numbers look like? So 144 people, that's a lot of people in the last year. What does that number look like compared to previous years, like say 5-10 years leading up to now?
I recognize the Minister of Addictions and Mental Health.
Yeah, so I would say we're very active participants with the national framework. There's certain specific elements that we're, integrating into Nova Scotia, I would say, especially, for example, with the Nova Scotia Health and IWK intake process, very evidence-based, high priority, I would say, based on extensive suicide risk assessments. I don't have the year over year, but I think generally speaking, there's been increasing trends, especially in the 20 to 44 age group and the 60 plus age group, both for males and females. So generally speaking, I think, it's concerning. So I think certainly with the launch of the new plan, we're always looking at ways how we can improve things here. We did do an extensive communications plan last year for men's mental health across the province, which had significant reach. It's just difficult because, it's difficult to quantify how impactful that is, right, with rates. So it's certainly a complex issue, but we'll certainly do whatever we can to try to combat things as best we can. Thank you.
I recognize the MLA for Cumberland North.
Thank you, Mr. Chair. So do you have the numbers? Would the minister have the numbers, what they've looked like over the last, say, 5-10 years, just so we could know what it... Okay.
I recognize the Minister of Addictions and Mental Health.
Yeah, we can certainly get those and follow up. That's okay. Thank you.
I recognize the MLA for Cumberland North.
Thank you, Mr. Chair. And, based on what you've shared, Minister, that there is a trend definitely up. As from what the Minister shares, that there is no suicide prevention strategy being worked on. Is that something the department would consider looking at and starting to develop, given the increase in incidents of suicide here in Nova Scotia and the loss of life? Just thinking, if we lost 144 people to murder or to MVAs or any other cause, I'm sure there would be somebody looking at that and saying, what can we do to be preventing those needless deaths?
I recognize the Minister of Addictions and Mental Health.
So yeah, I would say we're very actively working, with the National Action Plan and taking, certain elements out of that and integrating them into the Nova Scotia context. So we'll certainly continue to do that. I think if you look at a specific, provincial suicide prevention plan specifically, we'll certainly have continuing conversations and integrate the national plan to the best of our ability with, evidence-based sort of practices. So I would say, those conversations are ongoing, but we'll certainly do whatever we can to improve things. Yeah, thank you.
I recognize the MLA for Cumberland North.
Thank you, Mr. Chair. And I'm looking forward to seeing the numbers. And certainly 144 people is a lot of people within 1 year for us to lose, any age. And those, especially, well, any age, but these are people that otherwise would be, anyway, I'm gonna ask another question. What are you doing, what's the minister and the department doing to support families who are trying to help their loved ones who are in desperate need of mental health care but are unable to ask for it themselves?
I recognize the Minister of Addictions and Mental Health.
So just maybe just a little bit of clarity, I guess. So look for folks that are in like a dangerous situation, maybe, or is it what do you mean specifically? Yeah.
I recognize the MLA for Cumberland North.
Thank you, Mr. Chair. No, what is the department doing to support families who are trying to help their loved ones? So, obviously, if somebody has a loved one that is suicidal, that it affects the whole family. And oftentimes families find themselves in situations that the support's not there for them. So the question is, what is the department doing to try and support families who are trying to help their loved ones who are in desperate need of mental health care?
I recognize the Minister of Addictions and Mental Health.
Yes, that's a bit of a complex one. So I think in terms of, I guess, hospital-based care, typically the circle of care should always include family members or loved ones close to the patient. But it's also kind of an opportunity to identify issues with the caregiver at that time too. So that's kind of one part of it, I would say. But I think as part of the work we've been doing in that area of the province around bereavement and emotional supports and sort of holistic, I would say, family care, there's been a lot of work done to really get folks engaged in the community. I know the IWK has a big focus on really family-centered care, patient-centered care, right, as part of that process. So there's a variety of ways I think they could do that. It's always complex because sometimes those people don't ask for help too, and it's kind of hard it is hard, right? So that's a couple of things I can think of, but I don't know if that answers the question or not, though. Thank you.
I recognize the MLA for Cumberland North.
Thank you, Mr. Chair. Well, I think, Minister, I guess maybe it's more of a point then is that there is definitely a need for families of people that are suffering from mental illness. It does have a direct impact on families, and I know I can think of several families that have had a loved one and they've come to me and they don't have. There's still a lot of hidden conversations in the community around mental illness, and people don't openly talk. Like if they're in the hockey rink, they don't often say, it's not like, oh, my so-and-so just had a heart attack last week. It's not the same kinds of open conversations when it comes to illness, around mental illness. And a lot of times families are not aware if there are supports and often aren't comfortable, I guess, asking for help. But there is definitely identified needs for family members of those that are suffering from suicidal ideation and mental illness. So maybe that's, I don't know if that's something that the minister would be willing to look at. And I know there's certainly family members that I know that would be willing to meet with anyone in the department to share their lived experience and improvements that they would like to see. So, and then I'll move on. It's kind of on a related note, but with addictions, similarly, that there is a need for supports for family members of when they have somebody who's struggling with addictions, whether it be with illicit drugs or gambling or other forms of addiction. There's not a lot of supports for family members as well. And I'm just wondering if the minister could speak to that to see if there's anything being done in the department to try and improve the supports there for family members.
I recognize the Minister of Addictions and Mental Health.
Yeah, so I think the recovery support centers can be a great resource. I was in the one in North Sydney there a couple months back. You just kind of can walk in, right? Their kind of main area of focus is really substance use and gambling and family, sort of family focused. There's some aspects of primary care there too, to check on things. So I think that'll be a great resource for people that can kind of talk in that kind of group setting if they need some kind of supports. And there's no referral needed from your provider, which is good too. So it's pretty accessible. So that's, I think, one good example of a recent, investment for that. Thank you.
I recognize the MLA for Cumberland North.
Thank you, Mr. Chair. Can the minister explain where those supports would be found throughout the province, other than Cape Breton?
Recognize the Minister of Addictions and Mental Health.
So yeah, all the recovery support centers would have it. So the Amherst, Spring Hill, every health zone now has at least a couple, right? I have the list here somewhere, but there's 10 open now. There'll be 12 will be operational by the end of fiscal. So and they're all the same model of care. So education with family too is also an important part of those services. So I think they're a really, good thing in the communities. Thank you.
So I recognize the MLA for Cumberland North and advise that somewhere around 7:13, 7:14, we're going to close questioning. So we've got about, 5, 6, 7 minutes left. Okay.
Thank you, Mr. Chair. And I'm still a registered nurse and still see patients sometimes. I'm not actually aware of this, even in my own community. And I often advise patients, so I'm wondering if the minister can explain to me a little bit more about these resource centers, where they might be located, and then I can be sharing that kind of information with constituents, because I'm not even aware.
I recognize the Minister of Addictions and Mental Health.
Yeah, so the Amherst location isn't open yet. It should be open shortly this spring. Spring Hill, we're not 100%, but I know that's close. So there'll be two new sites. So in Northern Zone, yeah, so they're also in New Glasgow and Truro. Central Dartmouth and Halifax, and Cape Breton has Sydney, North Sydney, and Strait Richmond. And they're also in Middleton, Lunenburg, and Yarmouth, so kind of right across the province. So I can certainly ask the department to give you some details when that will open, and you can kind of maybe let your constituents know. Yeah, thank you.
I recognize the MLA for Cumberland North.
Thank you, Mr. Chair. And can the minister let me know, are they open in other communities as well, or are they all going to be opening around the same time throughout the province?
Recognize the Minister of Addictions and Mental Health.
So yeah, those are all open. They open at varied. So these are the last two to open across the province. So I think they've been very successful. Had about 8,000 patient visits, I think, last year alone. So it's good. So this will be 12 and gives us, I think, pretty good coverage across the province. Yeah, thank you.
I recognize the MLA for Cumberland North.
Great, thank you, Mr. Chair. And is this the integrated youth services that the minister is referring to, or is there something different?
I recognize Minister of Addictions and Mental Health.
Yeah, this is something different. This is integrated youth services is for like age 12 to 25. This is for like the 18 plus adult population. So two different things. Yeah.
I recognize the MLA for Cumberland North.
Excellent. Thank you, Mr. Chair. Well, I'll look forward to getting more information on that and the date that it's opening and the location and all that. One of the last questions I'll ask the minister is how much money in this budget for the year ahead is allocated for mental health, public education, and prevention?
I recognize the Minister of Addictions and Mental Health.
Yeah, so there was a curriculum piece in the school system with English and French curriculum, which I think had very positive feedback. That was in a select number of schools across the province from April of 24 to June of 24. So we got a lot of feedback from educators, did update some of the materials. So I guess some of the key points of that program is understanding how to seek support, social media and its impacts on mental health, coping strategy, resiliency, and those sorts of things for the kids. I know typically it's in grade 6 to 9, so kind of junior high age group, which is kind of what those most formative years, I guess you would say, for those sorts of things. So I think that's one good example. And there is a public education campaign too being looked at now provincially. So, but I think the curriculum piece is interesting because I think it's important, right, for the kids at that age. So that'll be rolled out across the province. Yeah, thank you.
I recognize the MLA for Cumberland North and ask if maybe we could wrap it up and leave just a few minutes for the minister to have closing comments.
Okay, good. Thank you, Mr. Chair. And I don't know if the minister would be able to let us know the dollar amount that's budgeted for the public education piece and what age that was targeted to in the curriculum.
Recognize the Minister of Addictions and Mental Health.
So I don't have the specific dollar figure from the folks at finance and get that for me, but the age group is grade 6 to 9, so we can follow up with the financial part. Yeah.
Thank you, Minister and MLA for Cumberland North. So with about, I think, 7 minutes left, 7-8 minutes left, we'll give you a chance to wrap up your comments, Minister. So I recognize Minister of Addictions and Mental Health.
Sure. Thank you, Mr. Chair. I want to thank my colleagues for the thoughtful conversation. I think in questions, I thought it was a really productive discussion. I want to thank my folks with my staff here today, who I think are doing an incredible job, and it's not easy. We're small but mighty, I would say. So we're doing some good work on behalf of Nova Scotians, and we'll continue to do that. So I'm going to read my resolution now, E29. Resolved that a sum not exceeding $363,793,000 be granted to the Lieutenant Governor to defray expenses in respect of the Office of Addictions Mental Health pursuant to the estimate. Thank you.
Thank you, Minister.
So we do have 6 minutes left. Ask the committee to unanimously agree that we completed 4 hours.
So I guess I jumped the gun by a little bit, and we do have, I thought you were going to talk longer, Minister. We do have, I thought you had, sorry. I don't know if we can we?
The ministers.
Are you okay, Minister? Yes. Oh, sorry, yeah. Okay, I recognize the MLA for Cumberland North.
Thank you, Mr. Chair. I did have one other question I was hoping to get in. It's around gambling. So gambling is pretty serious, I believe, and it does drive me a little bit crazy that our government is in the business of gambling. And some people would argue that if people are going to do it, it'll do it whether it's Atlantic Lotto or someone else. But I'm just wondering if the department is looking at the connection between gambling addictions and mental illness and doing anything at all to try and prevent the online gambling, especially sports betting. I mean, we're all probably going to watch the hockey game tonight, and depending on how late we have to be kept here. But chances are a lot of the advertisements will be about betting. And I have 3 sons who watch a lot of sports, and the temptation is just very great. Like, it's in their face all the time. I'm just wondering if this is something that department's looking at all to try and either A, prevent and or provide supports for those that may be struggling with addictions from gambling.
I recognize the Minister of Addictions and Mental Health.
Yeah, it's an important issue. I think it seems like it's everywhere, right? When you're watching the hockey game or watching, TV, those sorts of things. And there's thousands of unregulated gambling, websites and apps and different things. I think one thing with the government, I guess you would say, site is that it's regulated. There's very clear information on mental health supports and those sorts of things. I mean, I do think the recovery support centers can be very helpful too. They do kind of specialize in gambling. Gambling and substance use are kind of the 2 main things. So yeah, we continue to work on that issue. It's such a pervasive issue nationally too. I don't know there's no easy answer, I don't think, right? But we continue to offer, I think, robust supports for it as best we can. With the unregulated market for gambling, it's tough. It is tough for sure. So, but I do think these services for folks to hopefully they reach out for help when they need it. Yeah, thank you.
It's now almost 7:20, and just read slow. We close it off. Shall the resolution stand? I have to read that.
Thank you, folks. The resolution 29, read by the Minister. I asked the question, shall the resolution stand?
Yes. Resolution is stood.
Great, got it.
Resolution is stood.
The resolution has stood. And so I just, it's going to take me 2 minutes here to, it is now almost 7:20, and that concludes the subcommittee. And that concludes the subcommittee's consideration of estimates for today. The subcommittee will resume consideration when the House again resolves into a committee of the whole on supply. Please return to your seats in the legislative chamber. The committee of the whole must rise and report before the House concludes its business of the day. That concludes today at 4 hours. Okay.
So we're adjourned.
We are adjourned.